to Asylum Radio with your host, Annabelle Mendoza.
Recording. Hey, Krystal, how are you doing?
I'm doing awesome.
Let's push that mic right to your face, like that nice closer feeling. Like the mic, you can just push it close, like all up in there.
Is that better?
Yeah.
Okay, cool.
Can you tell the difference?
Yeah.
In there? Yeah, awesome. So, tell everybody who you are. Welcome to the show.
Hi, everybody. My name's Krystal Jade. Instagram, I'm Nurse Chris Chaos. Yeah. What's up?
Who are you and what do you do?
Who am I and what do I do? I'm a licensed vocational nurse. I work outpatient right now. And yeah, I kind of have a boring life. I'm not going to lie.
What? I would not call your life boring at all.
Well, through this pandemic, no.
Okay, even before then, no. What the fuck are you talking about? Okay, she's being very humble. So you're a nurse, right?
Yes.
Licensed vocational nurse, which means you work at a hospital in what department?
So it's basically family practice, internal medicine, urgent care, and pediatrics. So it's an outpatient. I don't work in the hospital. I work more of like a Kaiser, what is it? A healthcare partners. So something in that.
So do you treat people who are dying?
Yeah, and we try to prevent it.
Okay, yeah, that's fucking exciting. Yeah. I like, no, like, what the fuck are you talking about? Oh, my life is very boring. And I just see dead people on the floor convulsing. And I just like, nurse. Right? No. So your life is very interesting. And you're also a model and a specific type of model. You're a pinup model.
I wouldn't say a model per se.
You're a model. Shut the fuck up.
No, I'm not.
You're fucking gorgeous. Okay. So
Thank you.
I don't want to jump ahead, but aren't you published?
I am.
So
I am published on pinup culture.
Okay. Pinup culture. So most Instagram models aren't published. There's a big distinction between a model, Instagram model, and a published model. That's like the difference between a Corvette and a Camaro. There's a big difference. They're both nice. They both look good. They both sound good. But there's one you want to buy and there's one that you can actually buy. You feel me?
Right, yeah.
Okay, good. So tell me a little bit about your nursing. Like what led you into nursing?
So my parents, they had medical conditions.
Mm-hmm.
And, once my father passed away when I was about 11 or 12, I thought that, if I could prevent, what happened to my dad with anybody else, I'm saving a life or, possibly not reversing per se, but helping them control their levels of like if it's glucose, lipids, stuff like that. My dad had heart disease. So, and he didn't have the best diet, even though he was very athletic. He looked good on the outside, but on the inside it was just, good. Yeah.
So that was like your main driving force to getting into nursing. Did you want to get into that specific field just because of your family, or was there anything outside of that?
Not necessarily. I just, there wasn't anything outside of that.
No driving force to heal the world.
It was either be a teacher
or
nurse or, what is it? Mortuary science. I was really interested in that. Yeah. Yeah.
Okay. So you like dead people.
I mean, the dead don't talk back. So I don't have to.
You're like, they don't mind my attitude. So
yeah. I mean, I'm more kinder to them. So.
This is fucking okay. They don't know you. I know you. So that's fucking hilarious. So mortuary science. So why didn't you get into mortuary science?
So I'm horrible at math. And one of the prereqs was taking stats. And I was like, no, I'm just going to fail that shit. So I was like, let me just get into nursing school.
So, okay. Did you have problems getting into nursing? Like, cause
you know what? I remember her face to this very day because I did medical assistant. I went to schooling. I never worked as a medical assistant. After I got my certificate, I went directly into nursing. However, I was talking to the advisor counselor, and she was like, yeah, you won't make it in nursing school.
Oh, she just told you that?
She straight up told me that.
Oh, shit.
Yeah, she's like, you're not going to make it.
She's a fucking savage.
And I was like, fuck you, bitch. And then I went to a different school.
But did you actually tell her that?
No, in my head, I was like,
you should have told her.
What the fuck? But no, I went to a different school, and where I went to it was an incredible experience. I won't forget my clinical instructors or my theory instructors. But you know, in August it'll be 9 years that I've been a nurse.
Really?
Yeah.
9 years. Wow. So when you made that decision to get into nursing, like getting into college and all that, did you start off in a vocational school?
Yeah.
Okay.
Yes, I did. Yeah.
Did you fall into one of those traps also where they like get into medical billing first and then we'll move on from there?
No, because if I did, I'd be, in major debts right now. So no.
So luckily you didn't, but did anybody talk you out of it or try to talk you into like medical billing or try to like, because I don't know if you knew, I'm pretty sure you do since you're in the medical field, that a lot of vocational medical schools would pop up that have nothing to do with the medical field. They would try to push students into like medical billing or I forget what it's like, filing or whatever the fuck it's.
Yeah. What is it like? I think it's like coding or something.
Yeah, medical coding or something like that.
No, they didn't push that on me because like even though if they even tried to like explain it to me, I was like, no, I'm not interested in it. Like
that's good.
I don't want to sit behind a desk or.
They're lying.
I mean, you can make good money.
You could, but if your goal is to get into like the medical field, I feel like that's not really in the medical field. I feel like that's like a supporting role. It is
a supporting role.
That's just me. I could be completely wrong, but I've had friends who wanted to be RNs and they wanted to be doctors, and they went to, was it Everest?
Oh, Everest. Ooh.
Yeah.
What is it? I don't think that school's accredited anymore, and it's no longer in existence.
Yeah, it went bankrupt.
Yeah.
So a lot of students went to get into their field, and they gave them like these options, like, hey, get into medical billing first because the main classes are full. We'll rotate them out. You'll be the next person in, and then they would keep doing that to people, and kids would drop like flies, right? So you would get into this class, it would take forever, that has nothing to do with what you're in, and then you would drop out with like $30,000 worth of debt for a semester. Yeah, right. And it's a vocational school. So you're like, okay, that's cool. I'll just transfer over to RCC. Some name a school, UCLA, whatever you can get into. Yeah. You find out you can't even use their credits.
You can't.
And you'd be stuck with $30,000 worth of debt, no education, and you can't even get the job because they would guarantee you a job if you graduated, right? If you did manage to go through your medical billing stuff or whatever field you were in, they guaranteed you a position in the field. That was like their hook. And then they got sued for not being able to get their students into a position in their field. And then they went bankrupt. But
yeah, that sucks.
Yeah.
My sister-in-law, she actually went to school for medical assistant in it was called 4D College, I think. Have you heard about it? It's somewhere out here. I don't fucking know where it's at. But yeah, I guess they weren't accredited. So she basically spent I don't know how much money, and she doesn't even have her certificate, or she's not
I want to know how that works. Can you just start up a school and be like, hey, we'll teach you this stuff, but good luck using it?
Yeah.
Like,
honestly, yeah, you can. You could start up pretty much anything, but you, as soon as like the state or whoever comes, it has to make sure that it's like within regulations, within the curriculum, all this other type of shit that, is required. And if it's not, it's like, oh, okay, you guys are not required. You need to shut down because basically you're lying to all these kids and you're,
See, that's fucked up because there's a lot of people who right after college don't know or not even college, right before college, getting into college, they don't know what they want to do in life.
Yeah, exactly.
You have your big three, right? Doctor, lawyer, police officer. And then what else is there?
Would you say police officer?
Well, before.
Oh, okay.
When you're little, when you're in middle school, growing up, they're like, you want to be a doctor, you want to be a lawyer, you want to be a police officer. Those are the three that they always push on kids.
Mine was teacher, but
really?
Then again, I do come from a family background of law enforcement, so
they're probably like, okay, it's not as cracked up as it's supposed to be.
Yeah. So like my dad was like, no, that's a hard pass, Krystal. You're not doing anything in law enforcement.
They're like, look, they're lying to you, kid. Sorry, it's not as cracked up as it is.
And it's not.
Right, because once you leave high school, it's either you already know what you want to do or you're lost.
Yeah. Well, I wouldn't say lost. It's just that you don't have that right direction. Like I said, you're not lost. It's just that you're kind of like a little bit all over the place.
Yeah, that is a thing. But see, then those schools, right? They're like, hey, we'll get you into a field and we'll get you a job. And that's what anybody wants. And then most people go, I'll give it a try with no financial experience whatsoever. That's kind of shitty.
No, it is. And what is it? I want to say if I would have known what I know now, I would have went to just a regular community college. So
see, is that the move?
So I don't know if, you know me. So I'm adopted. Mm-hmm. So basically I'm, what is it? A ward of the court or court of the ward or something like that. So if you're adopted or have ever
spoiled?
been shut up. If
brat?
If you've ever been in the foster care system, you could get schooling for free actually. So
really?
Yeah.
Up till what age?
Doesn't matter. I'm like,
oh, really?
I'm 32 and I'm been going to school for free.
Well, you look great for 32.
Oh, thank you.
But so you can go to school like for free anywhere?
Yeah.
Like anywhere. Any
community college, any college that has the Guardians of Scholar program.
I have no idea what that is.
So basically it's like, they're the ones that are, responsible for, like kids who come from the foster care programs. Like, so obviously we're from two different counties. So in Orange County, it's Orangewood.
Yeah, I'm poor. Sorry.
So for Orangewood, that's within the foster care system, the city and everything like that. So, they'll have social workers or counselors come in and they'll talk to them about schooling, scholarships and everything like that.
Oh, wow.
And, they'll apply. There's so many different scholarships, even with this program too, as well. But, you have to be a certain age to qualify to get like more scholarships or anything like that.
But so as long as this program, as long as a school has this program or is a partnership of this program, you get free schooling.
Yeah.
And with no age limit. So you can be like 40, 50 and go back to school.
I've seen probably people in their 50s in this program. Yeah.
What the hell? And do you need any documentation?
Yeah, you do need that documentation. Yeah.
Because I can't just be like, I'm adopted. Let me get some let me get some schooling, please. No?
No, it doesn't work like that. I'm sorry.
Because I could get adopted. That'd be fine. I'm anybody with a loving home, I'm looking for one. But that's awesome. I didn't know that program existed. That's amazing. And I'm assuming you took full advantage of that.
Hell yeah, I did. Like, shit, school's expensive. Books are expensive,
it is.
Dude.
It is.
Like, oh my God, it's so expensive. And
so are there like Ivy Leagues you can go to? Like Harvard, Yale?
So what is it? I know Cal State Fullerton, Cal State Dominguez does not have the program. Cal State Long Beach has the programs.
That's amazing.
However, you have to interview for it.
Oh.
Yeah, so you have to go in front of a panel and
that sounds sketchy.
No, it's not sketchy. It's because there's a lot of people that are coming in like from the foster care system.
That sounds sketchy.
No,
that sounds sketchy.
It doesn't. But like
okay, so you're telling me I'm going to walk into a room in an interview for me to receive free education that taxpayers paying for.
But here's the thing. It's not just free. You're getting money to go to this university.
And I'm getting money?
You're getting money. Yeah. Each semester you get like.
Bro, why was I not adopted?
Because your parents love you. They love love.
That's hilarious. Yeah, sure. Why not? Let's yes. Yes. The answer is yes.
I know.
Okay, so you get like does it like a lump sum of cash?
Yeah, it is actually. It's more than $1,000 each semester.
That's pretty good. That's almost as good as the Pell Grant. Oh wait, do you get the Pell Grant on top of that?
I'm not sure, to be honest.
Does it cover like rent?
It actually can, yeah.
Dude, that sounds awesome.
Yeah.
All you kids who are adopted, please take advantage of this. This
or
is
in the foster care system. You don't have to be adopted. Just
in the foster care system. Yeah. Wait, so that means you could have never gotten adopted as long as you were in the system and then made it on your own.
Yeah.
Wow, really?
Yeah, I know. Who was it? One of my friends, my colleagues, she was in the foster care system. She was never adopted or anything, but she was in the foster care system. And
she aged out and then she just found out on her own and went to school?
Yep. Well,
That's awesome.
I actually told her about it. She did not know.
Oh.
Yeah, I told her about it and she applied to, different community colleges because I don't say we're all LVNs at my job, but
Pretty
there's
much.
a handful of LVNs and a lot of them are medical assistants. So she didn't know that. So I told her, I'm like, yeah, you just have to show the paper, have a paperwork stating that you were in the foster care system and just give it to them. And then boom, you get schooling.
That's dope. That's an amazing program. I really wish more people knew about it. Hopefully people know about it now. But after you started going to school, right? Now that you did your thing, you instantly went into nursing, or did you just dabble like everybody else does in college?
So for nursing, it's competitive. I'm not gonna lie. After
I heard the medical field's like monstrous.
Stupid.
I also heard it's like a man-driven field. That's what I heard. Not nursing. I heard like medical field in general. It's like super competitive, which I don't understand.
I never understood it either because, we're in demand of nurses, but all these schools want you to have like a 5.0 and shit. And I'm like, if you're an adult and you have kids and
for sure,
you have to go to work and like, it'll be fortunate if you have a spouse that you could actually stay home and go to school full time. That'd be great. But, that's not
a lot of people don't.
Yeah, exactly. So it's like, fuck. Like for me, I can't stay at home and go to school full time. Like, no, I can't. I did it for when I was in college when I went to nursing school. But now if I would get into an RN program, I'd have to go to work and go to school.
Oh, no, that sucks. Because, okay, just the job in general, nursing, medical field is already long hours, right?
It depends. I only work 8 hours.
Oh.
Well, it's 8 hours. 8 hours sometimes feel like 12. So
really? Well, there's some fields that are a little worse, but I heard the medical field, there's like 12-hour shifts. Like I'm basically basing this off of like TV dramas.
Of course. No, like I said, it depends on where you work. If you're in the hospital, it's going to be 12-hour shifts. Or if you're in a skilled nursing facility, which are called SNFs, it's going to be maybe like 12-hour shifts. I particularly never liked skilled nursing facilities.
What exactly are those?
So basically, let's say grandma broke her hip. Everybody's working. Let's throw grandma into a home while other people could watch her, feed her, change her.
So it's like a nursing home.
Yeah, pretty much. That's what a skilled nursing facility is.
Oh,
yeah.
I don't like nursing homes.
Yeah, I don't either.
So I had an ex who worked hospice.
Okay, yeah, that's kind of depressing.
Yeah, but she was something else. She would come to me and tell me stories of hospice, and I'm just like, I'm supposed to listen and make you feel better, but now I feel like shit. Okay, this is horrible. I'm like, and this, I don't know if it's every culture, but it was primarily white people who were in the nursing home.
It depends on the area too, to be completely honest. Like
it could be.
So for instance, in Orange County, like right where I live, it's I think it's Vietnamese. It's a Vietnamese nursing facility. So what I noticed when I was doing my rotation, it was mainly Asians.
Really?
Yeah.
That's strange because they're very tight knit families. For the most part.
I want to say it was mainly Asians.
Like what kind of Asians?
I think it was like Korean, perhaps Vietnamese.
Yeah, man, because Mexican people, good luck trying to get that old lady out the house.
I would see some here and there, but
good luck. I'm pretty sure they she clawed some eyes out on the way out. I guarantee it. Like there's, she's like, what do you mean you're taking me to an old people home? This is my house. She's probably stabbing kids out the way out.
Yeah, definitely. She's like, no, I know what time it is. No, you don't, lady.
Like,
It's
Mom,
like
you're not wearing a watch. She's like, don't tell me what time it is. I know what time the sun comes up. Now, definitely skilled nursing is a thing, but is that on the nursing home is the only type, like, is besides nursing homes, or is there another type?
Convalescence.
What's that?
So just like they're basically nursing homes, and they're also like it's called, what is this?
Sorry for my ignorance. I know nothing.
No, it's totally cool. I used to do biometrics at this one place for the elderly. So it's basically, like you said, it's mainly Caucasians.
Mm-hmm.
It's very upscale. So they get,
fancy.
it's in like Huntington Beach, or if you can afford it, you know,
Oh, shit.
they give you their meals, they help you get dressed. They have all these different programs, movie night, dances, all these.
Oh shit! That sounds awesome.
It's really nice. And I'm like,
So
shit, can I
die here?
adopt me? Like, you guys have money, and you know.
Hey, I'm pretty sure if you tried hard enough, because from my understanding, from like the stories that I heard, like some of those guys like have no shame, like whatsoever.
Hard pass. Hard pass on me.
Well, I could tell you stories, right? So from what my ex told me, that they had an outbreak of, was it syphilis at the nursing home?
Syphilis?
Yeah. It was some type of venereal disease. I don't know if it was syphilis
Are you
or
sure?
gonorrhea.
Perhaps gonorrhea.
It was one of
It
those
was
two.
gonorrhea or chlamydia, because syphilis.
It was a venereal disease. That's all I know. That's all I can remember. But apparently it spread like wildfire.
I'm pretty sure it's gonorrhea or chlamydia.
Apparently it spread like wildfire. And I was like, wait, what? Aren't these old people too old to be having sex? And she's like, no. Like, you will find these cats just run off somewhere. And I was like, oh, yeah. So she would have to go and break them up and be like, okay, two adults, you guys need to stop, because she probably doesn't understand what's going on right now.
Yeah, no, that's a hard pass.
Yeah, right?
I don't see grandma having sex or anything like that. Like,
It was her job.
grandma.
Senora, stop. She's like, mind your business. I know what I'm doing. I heard I don't know if it's true, but from my understanding is that some of those people like kind of know what's going on, but they're like, oh, dick? Okay. I don't know if it's true. You're in the nursing field. You could maybe tell me.
I don't know. That's a whole different realm. I don't.
That's what I was told. I was like, okay, that's crazy. I'm like, that's gross. That's gross.
It is just a bit. Well, you know, with the patients that I get, you know, you'd be not surprised, but like, you know, I have to have habitual patients that would come in, and I'm like, bro, like, you've been diagnosed with like gonorrhea. This is like the third time. Like,
jeez,
maybe you should leave your partner. Like, I don't fucking like, you know, I try to counsel them, and you know, as well as the provider too, and sometimes they just don't have that rapport with the doctors. Mm-hmm. So, you know, I'd tell them, and like even like young kids. I remember this 16-year-old.
What did he get?
I believe he had gonorrhea.
Okay.
No, not me. Okay.
Meh.
Oh my God.
Continue with your story.
It's just mind blowing me that, you know, a 16-year-old was like, oh yeah, my urine's burning. I'm like, okay.
Was he like super shy about it? Like, so,
well, so it was a physical exam. So it's called a well child check, just because of the age. And, there's questions on there. I'm like, hey, do you want your parent to be in here or have them step
some
out?
Privacy.
Yeah. So he was like, yeah, I can have my mom step out. I was like, yeah, sure, no problem. I was like,
and she's
all
just like, I'm gonna kill you, motherfucker.
So, and I don't think the mom understood English, but still, I asked him all these questions.
Oh, she knew. She knew for sure.
Well, perhaps.
She knew for sure.
You'd be surprised at the stuff that I see and hear. I'm like, oh my God.
Okay, continue. So mom stepped out. What happened?
Mom stepped out. I asked this kid about like drugs, you know, alcohol, sex? And he was like, yeah. I'm like, are you using protection? Yeah, but it burns when I pee. And I'm like, homie, okay. I'm like, I'm gonna need a urine test from you. And then, yeah, 3 days later, come to find out he had gonorrhea.
Oh no! So in that situation, what do you guys have to tell his parents? Be like, oh, we're gonna give him this medication.
No.
He needs to be on it.
No, we don't have to. You don't have to disclose that.
Oh,
Yeah, but you can treat their partner. So if you have gonorrhea, chlamydia, or any venereal type of disease, you have to report it to the county.
The minor has to report it to the county.
No,
you have to report it to the county. That a minor has whatever. Oh.
No, just anybody in general who gets like a venereal disease. Yeah.
And why is that?
Data,
like statistics?
Yes.
So they're like statistically tracking how many people get VD.
Pretty much, yeah.
Why?
I don't know.
That's a strange fact.
No, but yeah, they do. I remember I went to Mexico 2019.
Oh, that story already sounds bad.
I know, it was.
You're like, I went to Mexico.
So it was TJ. I went to see Demand at Our Go. And I was with my ex at the time. And he was like, oh, it's Mexicans, because he's Hispanic, he's Mexican. And he was like, oh, it's Mexicans. We have stomachs like, we're good. And I was like, okay, whatever that means. So him and I, we both drink water.
Oh, so goodbye.
He was fine.
Goodbye.
But me, on the other hand, I was dying the whole entire trip.
No one told you to not drink the tap water?
I wasn't thinking about that.
Were you drunk and thirsty afterwards? Is that what happened?
Perhaps. I should have just been drinking the whole entire time.
That's what they advise you to do. Yeah. They're like, don't drink the water, drink the beer. And
the interesting thing is that like we went to this place and it was a Filipino dude that owned it. That's interesting. He came from LA.
You sure he wasn't Mexican, but just with the little chinky eyes?
Oh my God. Yes.
There are Mexicans with chinky eyes. I'm sorry. That's true.
Yeah. You're like, you're Filipino? No, ma'am. Or like even ladies, my little senoritas and stuff like that. They're like, they'll talk to me in Spanish. I'm like,
ooh, almost called you Asian. It's okay. I think it's just because the more native you get, the more those traits you pick up.
Yeah.
Yeah. I don't know. So this Filipino guy at the bar told you is he the one that fucked you up?
I'm pretty sure it was the dude. Yeah, because we went to this.
He's like, here, have some tap water.
Yeah.
As he stirs it.
Now that I'm thinking, I'm pretty sure it was that spot that fucked me up, and I had to go do a test and everything to know what was wrong, because I was like, it's just everything was going in and out. Everything was going in and out.
You're just shitting.
I hated it, right? What is it? So my insurance, it was like I was transitioning to a different insurance. And they're like, oh yeah, you have a shingatoxin.
What the fuck is that?
So it's basically a viral stomach infection.
Oh shit.
And it's contagious.
Wait, what?
Yeah, it's contagious.
So
I
questions. Yeah. Lots of them.
Go ahead.
One, why does it sound so bad when you say shingatoxin or whatever? What was it called? One more time?
I believe it's a shingatoxin.
Shingatoxin. That sounds horrid. One, why does it sound so bad? Two, how the fuck is it contagious? Like, are you guys going ass to mouth? Like, what the fuck?
Basically with the whole hand washing hygiene thing.
Oh, so I guess. No. But who the fuck isn't washing their hands?
You'd be surprised when the first lift happened. I was reading, and I kid you not, it even said Caucasians are not washing their hands as much. And I'm like, what the I'm like, people are disgusting in general. Like,
okay, those are probably dudes. They're probably guys. Let's be real.
Perhaps. I don't know. I mean, I saw.
Did it say Caucasian men?
No, just said
just say Caucasians.
Caucasians, yeah.
What?
Yeah. No.
Really? White people, what the fuck? Seriously.
Wash your hands.
That's bad. That's so bad.
It's disgusting. Like today I saw some guy, he sneezed in his hand and then he just went like this. I was like, ew.
Did he have options?
Yeah, his elbow. Yes, he had
Yeah.
a long sleeve on. I'm like, that's fucking gross.
Yeah. So the shikatoxin was in your system,
Yes.
and when you found out it's contagious, but luckily you wash your hands,
Yeah.
right?
So
What they do?
They called me and they're like, yeah, you can't go to work. And I was like, what?
Is it that bad?
And
Is it like life threatening?
no, it's not life
But
threatening.
it'll fuck you up, right?
Yeah. I mean, it was a nice couple of days off, but
While you're shitting your brains out, sure. Well, I guess not.
I mean, it was coming to a halt, but still, I was like,
You're like,
yeah.
You're like, yeah, boss, it's really bad at home.
Yeah, I came in
I
and
feel
I was
great.
like, I came into work and I'm like, I think they should go home.
These shikatoxins
Like
are
that,
fucking me up.
like that was even prior to me knowing anything. I was like, I think I need to go home because I'm like going to the restroom like quite often, and I didn't even start my shift. Like I was like maybe 5 minutes into my shift, and I was like, yeah, I gotta go.
Okay, without getting into too much detail, how bad was this? Like, are we talking like just you have the shits, but it's like 3 times, 4 times a day? Or is it like
It was like
a hose just
no, legit. It was
oh
like
my
a
God,
hose
that's
for like
horrible.
4-5 days.
Oh my God,
It
that's
was, it was
fucked
fucking
up.
horrible. Like here I was, thought I was supposed to have a good ass time in TJ, watching my favorite band at the Black Box, and
Pro tip, don't drink the water. Don't drink the water.
thank you.
At least not in TJ, which is so weird because it's right by the border, but at the border, for whatever reason, is the worst place to drink the water. Don't ask me why.
You know, my ex, he had it for like maybe a day or two, and then
You know
he was
what?
fine.
He probably already had them shikatoxins. He probably had his own shikatoxins, and they were just like cool with him. They were just like, okay, cool. What's up, bro? You're new.
He told me that he was fine. He was like, yeah, my stomach was hurting. You know, I had
He's
the
also a
shits.
guy. Guys will lie straight to a girl's face. Be like, yeah, babe, I'm fine. I don't feel anything. I'm fine.
You know what?
It's true. The truest shit at guys are horrible at telling girls the truth. We will lie to your face about pain. Like, we can get hit by a truck, stand the fuck up, be like, I'm good. No, it's fine, babe. No, my arm always bent that way. No, it's fine.
I guess it depends on like how you carry yourself as a quote unquote man. Yeah.
Yeah, I guess that's true.
Because apparently I haven't been with masculine men. I don't know.
Really?
Yeah, no, I'm mainly the alpha.
Oh, damn. So they tend to bitch to you a lot? Is that what you're saying?
Yeah. And then I'm like, yo, shut
the fuck up.
It's like, okay,
Krystal, but you're such a bitch. It's true. I'm just saying. You can be.
I can
You
be,
can be.
but I'm pretty sweet. I'm honest.
Okay.
Yo, I keep it real. How about
That's
that?
true. Okay. I'll be honest.
I tell it like it is,
You
even
do.
though,
You do.
know,
I'm not gonna
it may not be what you want to hear, but
See, but you have no filter. You could be like, oh, like someone, has anyone ever asked you, like, does this make me look fat?
yes.
Oh my God. How'd that go?
I was like, you know what? Not like that, but like one of my best friends, she sent me a photo. And
I
she
am
was
so
like,
sorry, best friend. Did she tell you the truth?
yeah, she knows I tell her the truth. Hey, you know I tell you the truth, girl.
So how she looked? She looked fat?
No, I told her, I was like, yeah, that color on you it's not appealing. And it does make you look not fat, but it made her look pregnant. So, and probably the angle too. I'm not gonna lie, it was probably the angle.
It was the angle, babe, that made you look pregnant. No, it was the angle. It's the angle that fucked you up. I'm sorry.
Like I said, like she showed me and I was like, oh. Okay.
It makes you look pregnant. You don't look fat. You just look like you had a baby. Are you pregnant?
No, she wasn't. But,
You're such a bitch.
yo, I just keep it real.
It's okay. It's okay. Sometimes honesty is the best policy. So, after you got your little shikatoxin thing fixed, did you learn?
Yeah, I haven't been to Mexico ever since.
Don't blame Mexico. Don't blame.
No, it's on me. It's totally 100% on me.
Okay, 1, you went to Tijuana. 2, you drank the water. 3, you drank the water from some, what, Asian, Korean guy who you do not know, just hands you a glass of water and you're just like, okay, that was on you.
That's what I'm saying. I'm acknowledging where I fucked up, and yeah, that was on me. Mm-hmm. Totally acknowledging that I fucked up. Mm-hmm. And like my provider will never like let me live down to it. He's like, hey, remember that one time and TJ got fucked up? I was like, yes, thank you.
Thanks for bringing up the shikatoxin.
I feel like it's like a yearly thing around this time. He'll be like, hey, remember that one time? I'm like, shut the fuck up, please.
Yeah, I remember those shikatoxin in that TJ water. Was it clear water? Did you look?
It was just like regular water.
Did you actually look?
It was like tap water.
Or did you really look?
Yes, I did.
No, you fucking didn't.
It's in a clear glass. What am I supposed to like?
He probably didn't even clean that glass. He probably pulled it off the bar.
Like that?
Yes. Yes. Yeah.
Yeah. No.
If you see little things swimming around, just.
I didn't see anything. Well, I didn't see anything swimming.
You were probably drunk as fuck.
I was getting that.
You're like, this looks clear. Huh? Okay.
Yeah, I was dehydrated. I wanted something to eat. I didn't care. And then obviously that
backfired.
Yeah. Mm-hmm. It really did.
Mm-hmm.
So.
It's okay. So after your whole little debacle, I forgot where we came from that, but I remember we were talking about your school. So you did your whole, what was it? How many years did you go to nursing school?
So it was a 2-year program because it was part-time. So if you go full-time, it's a year.
Oh, okay.
Yeah. So it's like more information crammed in your head. And I'm the type of person that's, I can't absorb things like right away. So I was like, hey, it's 2 years, whatever. I rather, learn it instead of just like learn it and have it like
disappear.
Tossed up. Yeah.
Use it or lose it.
Yeah. Like, what is it? Right now I'm dating someone.
Oh.
And he'll tell me about like all these like different side effects or like his, the people that he's seen like different conditions or whatever. And I'm like, what the fuck?
Like, how do you remember this shit?
And I was like, okay, dude. I was like, yeah, all right. I need to step my game up. Like I need to like do like more research. And I feel like I need a refresher on like some of like, just
terminology,
like, not terminology necessarily, but like, what medications can do to you, like side effect wise, and like how it affects like lab values, like your blood work and everything like that.
Right.
Like how it affects the metabolism for your kidneys or your liver and stuff like that. Yeah, no.
So you need to. That's one of the things I wanted to ask you. So your schooling comprised of what? Because you have to learn terminology, chemistry, right? Like chemicals and.
Not
pills
necessarily.
What exactly got broken down in your studies that you need to know to actually be a nurse?
What is it? Is it Maslow hierarchy of needs? Yeah.
You're asking me like if I know. No, I'm asking you.
It's like Maslow hierarchy of needs. You know what I'm saying? There's like 5 stages. I don't remember them all, but it's basically like that. They teach you just basically head to toe assessment. What am I looking at? What am I seeing? What am I smelling? What am I, what am I objecting to? Like, what am I seeing and everything like that? Or what is the patient telling me? We did, drug calculations. So like, for children, we'd have to,
how much of a dose they can take?
Yeah.
Oh.
And that kind of sucked.
And you guys have to do that on the fly, not the doctor?
That's just it. But yeah, the doctor does everything. Like they punch the numbers and like, all right, you have to give this dose to the kid. And I'm like, all right, cool.
But do they really do it?
Yeah, they do actually.
Oh, okay.
Yeah, they do.
Because sometimes I feel like the doctor's just there to go, and bye.
Some doctors literally do that, but sometimes you have to like, yo, can you fucking look at this, please, and make sure that this is correct? Because there's been times where I've had to like
check a fool.
Yeah, like I love my providers so much, but there are times where I'm like, yo, bro, like you put this IV like LVNs can give like, what is it? We give Toradol IV. So we can't give that. I was like, yo, can you just switch it? Like,
What is it?
IV or Toradol? It's just an anti-inflammatory.
Oh, okay. But in IV form.
So IV would basically, we'd have to set you up as an IV, but it's intramuscular.
Okay,
like
gotcha.
You could do it through an IV line.
But you guys aren't allowed to do it.
No, we can't push medication. However, we can do blood transfusion. So I don't know what's more scarier, medication or blood.
Huh?
Yeah, no.
How does that work?
I haven't done
Just
it.
a rule?
Yeah, no, honestly, it is a rule. Like we can't push meds, but we can do blood transfusions.
So nurses can't give medication. Doctors give medication, but who sets it up?
So for IV, the RN would have to do it. But we don't do IV meds. We'll give you an IV. Like LVNs are the ones that set up the IV.
Like saline and shit.
Yeah.
Gotcha.
Pretty much, but we can't push meds. That's if the paramedics come, we have their catheter set up and everything, and then they'll do whatever they have to do with it.
So what's the hierarchy? So I know doctors are like at the very tippity top, and then who's under them?
So it could be it's a physician assistant,
And who's under them?
nurse practitioner.
That's an RN.
Yes,
And then what's under that?
RN, BSN perhaps. Yeah, BSN.
And who's under that?
LVN,
And who's under that?
CNA.
Okay, why the fuck are there so many different nurses?
They just do a lot of different shit.
Just cause? So I'm assuming, I'm just going to give it a whack. Each level gets to do more because they know more?
Yeah,
That's about right?
It's kind of dumb, especially when it comes to CNAs. Because like, in my rotation,
Twist the mic towards you.
Don't
Don't be scared of it. It's not a thing that you might associate with things in your face.
Shut the fuck.
What? I didn't fill in that blank. You filled in that blank. That wasn't me. That was you. Okay. So just the thing is like point it at your face, right? Like yeah.
Is that better?
Does it sound better?
Yeah, it does.
Okay. There you
go. Shit. What were we talking about?
So the differences between like the different levels of nurses.
Okay. So basically, CNA, they rotate patients, they take them to the bathroom, they do basically body mechanisms.
Is that like the lowest rung?
Yes.
So that's CNA.
Yeah, certified nursing assistant.
Gotcha.
So LVN is licensed vocational nurse. There's just like a handful of things that we can't do that RNs can do and stuff.
And what can they do? It's like you guys can't, besides pushing medication.
So we can't give certain medication like testosterone. We can't give that.
Dang it. Okay.
We can't. So it's an injection. We've had a couple patients that would come in and unbeknownst to us, we didn't know. LVNs couldn't give it until, it was a word of mouth. And I was like, what?
Wait, so they came in for testosterone and someone just went...
Pretty much. And then someone was like, oh, yeah, that's a no-no. I was like,
in what instance do you just randomly give someone testosterone?
Well, if they're prescribed it.
Wait, so they would come in for like an appointment?
It's basically a nurse visit. Like, because they can't do it themselves, but...
Oh, so they're prescribed it and they're just coming in for their shot.
Mm-hmm, yeah.
And they're just like, stick me.
Yeah, pretty much. Pretty much, yeah. And like patients that would come in, they would have like preferred nurses and stuff. Yeah, no, it was that's a thing. That's a real thing, and it sucks.
They'd be like, let me get Krystal. She knows how to give me some testosterone.
Not like that, but I do have a couple of male patients that like,
they would prefer.
Hey.
Well, I guess that also your bedside manner, right?
Yeah, no, definitely.
Some people have a shitty attitude.
No, yeah. If you're a dick to them and you're like, and you don't give up, like if you don't care, if you're not like, I don't want to say wholesome, but if you're not authentic and like have that rapport with them, like, I don't want you to give me my shot, like I tell all the kids, like,
I know you might just hold it in there a little bit longer.
Like for me, honestly, when I give vaccines to like teenagers or like even kiddos, like the one that stings the most is HPV, is the human papillomavirus virus one. And that's a 2 or 3 dose, I believe.
Is it just the chemical that stings or is it the needle?
It's just the chemical.
Oh, that sucks.
That's it. It's just the chemical that stings. So I'm straight up with them. I'm like, all right, I'm going to give you the flu shot and I'm going to give you the HPV shot. One's going to hurt and one's going to sting. I'm straight up with them because, I feel as if I'm transparent, I have more rapport with them. They're like, well, how long is it going to stink for? I'm like, like maybe like a second or 5.
A second or 5.
But
that's kind of a big distinction.
yeah, I know, but they don't. Do kids have a concept of time though?
Do they?
I don't think so.
No, they don't. You don't think they have a concept? I don't know. Someone tells me it's going to hurt for a second or 5 seconds. I'm like, whoa.
Well,
is it 1 second or 5?
I don't tell them like, oh, hey, it's going to be hurting like 3 days straight. Like for the tetanus shot, the tetanus shot, like your arm's sore for like a couple of days. The tetanus shot. Yeah, I know. Mine's due in a couple of years.
It's okay. I don't know any of my shit, but besides that, so you guys aren't allowed to push medications like testosterone or whatever, and they are, right? So the doctor basically comes in and does what then?
Basically says like, hey, what's up? How are you? This is what's going on. This is your lab value.
So what is he doing? What are they doing?
Diagnosing them basically. So we could do nursing diagnosis, but we can't medically diagnose you. Like when they come in and tell me all these things, I'm like, okay, so it'd be, hopefully this is right. I don't know if it's right or wrong. It's anxiety related to patient lost job or whatever the case may be, just stuff like that. But the provider has to diagnose them with this anxiety disorder.
That seems so convoluted because every time I've went to the doctor, I've seen a nurse first. I told them what was going on and they wrote down whatever and did my finger thing and then they disappear. And then like 30 minutes later, a doctor would come in and then reiterate what I just told them. Yeah. And then they'd be like, goodbye.
So honestly, I'm going to be completely honest. They'll tell us like patients will tell us every single little thing. So for me, I mainly do urgent care and they'll tell me everything that's wrong with them. And I'm like, got like 15 fucking minutes and you're telling me your whole life story. I'm like,
so this one time in Tijuana, I drank some water.
I'm not gonna lie, we try to address like what's going on with them. But like when they're like, oh yeah, my back, my knee, I'm out of, my herpes meds and all this other shit. It's like
they just slide the herpes in between. Be like, I had this weird thing that happens when I sleep. Oh yeah, and I think I might have herpes. I don't know, but mainly the back thing.
Yeah, no, it's like I'm like, what are we treating you here for? Like,
so okay, so what's the move, right? Someone goes to the doctor and has a nurse. What is the move? They know what's wrong with them, but
so we focus on the main concern. Like, let's say you're a diabetic. Okay, we do your lab values and everything like that. That's our main focus. Is like, how is your
my question is should we tell the nurse what's going on or should we wait till we see the doctor and then give them the 20-minute spiel?
It's all depends on you because like even if you tell the nurse, the doctor's still going to find out no matter what. Like I get a lot of patients who have like substance abuse disorder and they're like, no, we'll ask that question because that's one of the questions. I'm like, oh, do you use any substances including marijuana? They're like, yeah. I'm like, any other substances? And that's when they'll tell me.
Any fun drugs like cocaine, ecstasy, heroin, any of the other ones.
Yeah.
And they'd be like, well, yeah.
No, yeah. And like for me, I could tell that, they've been, abusing. So yeah, they're like, no. And I'm like, okay.
A little
and
itchy.
Then, you have no idea. Not that. Like I get mainly people who are addicted to meth.
Oh.
Yeah. It's
How's that go? What did they come in for?
They come for like infections of the skin.
Ooh, a little too much picking.
Yeah, that or their what is it? Oh my God.
Teeth issues?
No, not necessarily. It causes them a lot of like I don't want to say schizo, like just different thought processes.
They're hearing voices
to normal. Yeah. So I've had one who had a patient who was actually, what is it? Yeah. She was, Substance abuse disorder, schizoaffective related to substance abuse. There you go. Yeah. So by the substances that she used, she became schizophrenic.
Oh shit.
Yeah.
But from my understanding, right? It's not the drug that's doing it. It's the lack of sleep.
No, I don't think so.
So meth, correct? Has a psychoactive component that could possibly lead to schizophrenia?
Yeah.
Really?
Definitely that. And like, what is it? Heart attacks, strokes.
That's a new one. I didn't know that.
Yeah.
The strokes and all that. Yeah. I didn't know you can become schizo from using that.
Yeah, you can. Yeah.
Interesting.
Yeah.
And I'm assuming at an extremely high dose.
Whatever they're on. I don't know. Like, I'm learning more about it. So it's really interesting, like what I'm learning.
That's fucking terrifying.
It is. It really is, because it's like, what is it? They said that we're now known for, what is it? Meth.
Wait, what, your area?
Not my area. My area is fine.
United States?
Your area.
Oh, welcome to my barrio, Holmes.
No, but I heard that apparently Hemet is known, we're well known for meth. California is well known for meth. And I'm like, fuck.
I thought we were known for good weed, but I guess not. I guess.
I mean, your illicit substances, I guess. I don't think weed's considered illicit anymore.
It used to be like 3 years ago.
Oh,
4 years ago.
But now it's like, oh, you're doing
you smoke weed.
Yeah. So no
one cares.
Yeah,
no one fucking cares.
But I'm not gonna lie, doctors do care, because they're like, oh, it's a gateway. And, I say it's like from the people who I've encountered with that have told me, because I've worked addiction recovery, and I've asked them, I'm like, do you think weed is a gateway drug to whatever, led to you to become, an addict? And they're like, yeah, most definitely. They started off doing weed.
I know you're starting to sound like a Dare commercial. Sound like Dare. Are you sponsored by Dare? Because we don't got sponsors yet, so you need to stop. No, but I get it. Yeah, we've all heard that story that weed is a gateway drug, and then if you're willing to try weed, you might try a little bit of cocaine. If you're willing to try a little cocaine, you might try a little bit of crystal meth. You might try a little crystal meth. You might try some heroin. And
I've also heard horror stories that like their first not drug of choice, but I was watching this documentary, and this girl, oh my God, her parents shot her up with heroin.
Oh, that's so bad. Why?
I don't know.
Why?
Yeah.
It makes no fucking sense to me. I get that, most of the time, people who are using drugs are looking for an escape.
Yeah, no, definitely.
Right?
Yeah,
some people choose alcohol, which is a legal drug.
Yeah.
Right? Some people choose tobacco. Some people choose weed. And some people choose shit that's a lot harder. I think that marijuana really isn't a gateway drug. I think if you're predisposed to having addictions, it just gives you the idea of pushing that further.
Yeah, no, most definitely. Especially if you have a family history of addiction.
Oh, yeah.
Yeah. No, most definitely.
But also there's something to be said about age, right? Because if you started smoking weed at 25, you probably would have, and I'm pulling this out of my ass, you probably would have a less likelihood of trying anything else, right? Because you were like, I tried at 25, kind of whatever. Meh.
You never know.
Right. You never know. Right.
What happened if you go to a show or a rave or anything like that? Like, oh yeah, I just tried weed and, and then somebody gave me this and I loved it and I don't know what it is. And now that I want more of it. You know what I'm saying? So it's like.
Yeah, but I feel like when you're a little bit older, you have not more common sense, but more experience to go, okay, I probably shouldn't do this right before I go to work. Usually there's a lot of dumbasses out there, but a kid, right? Let's say a 15-year-old, a 16-year-old who has no real responsibilities can kind of fuck off and be like, okay, yeah, I'll smoke some weed now and tomorrow and the day after, whatever. And if someone offers them free drugs that's better, quote unquote better, right? They might just do it because they're like, I ain't got shit to do. I just got school.
Right. Yeah.
Right. But as an adult, you kind of go, fuck, I got work. I got bills. I might not do this tonight. I'm sorry.
You'd be surprised.
I know. That's just my look at that situation. But you're right. It could be a gateway drug to some not so much. But I think age has to play a big part of it, and your like predisposition to addiction.
Yeah.
And your family history. But, and you guys see a lot of that?
Yeah.
Yeah.
We're, finally, we have, we only have one doctor that does that. It's substance abuse disorder. Like now they're bringing in psychiatry. However, so, we're placed in 2 different counties. So we're like the redheaded stepchildren. So like we're
the redheaded stepchild. No offense to any redheaded stepchildren out there.
No offense. So like we get like the last of everything. And,
oh no. So you just got your first guy to be working on people with addiction?
Well, he's been there for maybe like, well, he got certified maybe like last year or something like that, but he's been there for 3 years. So I'll be there at my place for 3 years in November. So he's been there when I started.
Okay.
And he's one of the doctors that helps with substances. We don't have anybody for alcohol abuse disorder.
So my question is, does anybody come in for weed?
No. Like why?
Well,
they like, oh yeah, please help me get off weed. No.
No, right?
No.
Like suspicious. Suspicious. I don't know. It's suspicious that's a gateway drug, but no one comes in for the addiction for it. Meh. It's okay. But so let's go back to your schooling. So you need to learn like dosing for kids.
And adults.
And adults, of course. You need to learn terminology, right? Like if a doctor tells you you have whatever that weird shikakaka thing was. Shikakakas, I forget, what was it one more time?
Like shigatoxin.
Shigatoxin.
I'm pretty sure I'm saying it wrong, but whatever.
You're right. Someone will correct you.
I'm pretty sure.
So I'd be like, sorry, that is not what it's called. The Latin term for this is.
No, seriously, then we'll.
Right. So there's a lot of terminology you guys need to learn. And you guys, most of it is Latin.
Yes.
Most of the entire medical terminology is Latin based. And then what else do you need to learn? Do they teach you guys finance? Like
finance?
Uh-huh.
We're in nursing school. What are you talking about?
See, I think that's such a big...
You're broke, bitch. Like, no.
You guys get paid? Okay.
Like, they tell us, like, okay, nursing school is going to be, depending on where you go. If you're LVN, RN, depends. So if you're going to, like, West Coast, you're going to be paying $100,000 plus.
Jesus.
All just because what they're offering, you get your RN, your BSN, and from the last time I checked it out, like, 5 years ago, and they were offering your RN to BSN and then case management.
What's that?
So case management, it's basically that you could check in with patients and see how they're doing and if like they're getting what they need. Like let's say I have a patient who's a transient or who doesn't have transportation. So we kind of like help you set that up. Get like to your appointments and everything like that.
And that's like a higher run?
Not
or is that just like an extra skill that you learn?
It's just an extra skill. Like it's basically like advocating.
Okay, gotcha.
Patients. Yeah.
So let me think about this. So what's like the pay grade then? Like they don't tell you guys like, hey, if you go here, you make this much, but if you get to here, you get this much. And if you get to here, you get that much.
All this, it depends on experience.
See, that makes no sense.
Well, it kind of, if you're a fresh grad, like, yeah, you learned everything, but do you really know everything? You know what I'm saying? Like I've been in the field for like I said,
that's like most jobs.
Years.
Yeah.
So, they saw that, oh, you're 9 years. We want to offer you this. I'm like, hell yeah. Like finally we got our raise.
Good for you.
I was like, we fucking need it since you guys didn't give us hazard pay, you assholes.
Dude, right? Like, a lot of jobs should have, but they didn't.
Yeah.
Especially you guys, since you guys in the medical field, like what the fuck?
Yeah,
You guys are the front line.
It sucked ass. Like, I want to say last year, we didn't get COVID pay.
What the fuck?
Until somebody
snitch. Someone straight up snitched, huh?
Yeah, and they were gonna sue.
Oh hell yeah!
They were gonna.
Oh
sue.
yeah, that's good.
And it wasn't even. It was a medical provider.
Oh really?
Yeah. And
they're like, fuck this.
Yeah, he
pay
was
me,
like,
son.
Yeah, no, because he got COVID and he couldn't get his short-term disability, and he was all like, "No, that's not happening."
I'm gonna call my lawyer.
Yeah, no, exactly. Like, dude, like this is his side job.
Oh no,
like, where I work is his side job.
So he was like, "Fuck this."
Yeah, pretty much. But
pay me.
he still works there, and he's a really great doctor.
That's good. But
he was an advocate for us. Like he,
oh yeah,
like,
for
even
sure.
When he was there, he was like, you know what? I don't want you guys doing all these tests. He's like, you guys are always
exposed.
At risk. And he's like, I'm tired of it. He was like, I don't want them coming in, and like how we run, our things are different compared to like other places that are, how they check in their patients and stuff like that.
Mm-hmm.
He was like, you guys are really organized over here. He's like, I like your guys' flow. He's like, different places, they just let anybody in. You can be COVID positive, they'll let you in.
Oh, shit.
Yeah.
That's fucking scary.
Right.
So I'll segue into that a bit. So I'm assuming the COVID thing sucked.
Yeah, it did.
Because I know New York got hit really hard initially. Like the West Coast, not as bad in comparison.
Not as bad?
But you guys are in the medical field, so it was bad regardless.
Yeah.
Right? How was that when they were like, okay, yeah, we're all fucked? Like when was it? Like around like March, February, when you were like, what the fuck?
I want to say it was March 15th. That was the last time anything was open. It was March 15th.
Did they do like a fucking powwow and be like, look, this is fucking serious?
Oh my God.
No?
Every single day it was something different. It's the CDC would change it, or the CDC would try to keep up. At that time, I was like, man, fuck the CDC. So, they don't know shit about shit. Like,
right? Okay, so my question is, do you guys get like a fucking email? Do you guys get a phone call?
No, we would get emails or from our...
the higher ups, the bosses.
Yeah, and to see like, oh, hey, this is what's changing, X, Y, and Z. And we're like, what the... Like, this is bullshit, because like the whole flow thing, like we didn't know what to do. And, a lot of us didn't have our proper N95s. Mm-hmm. So
because they were like shorted everywhere.
They were. And, people were ultimately scared that, some people, 5-finger discount. They're like, what's up? They would stock up. So,
right.
And, shit happened.
You got your free N95 mask. So, but when this shit hit the fan hard as fuck and you started to see, okay, because at the beginning, no one knew how bad it could be.
Yeah.
So they scared everybody, which is fine. Right. But was there like a disease protocol that was already in place for instances like this, being like, look, there's an infectious disease that's airborne that we have no idea how to contain it or cure it, but we need to diagnose it. Was there anything already preset for that?
Not necessarily. And what the media saw compared to what we knew, because they're like, oh, it's on your cardboard boxes, it's on your groceries.
Yeah, because that's what everybody heard.
Yeah. And I was like, what the, like, to me, it's like, where's the data at that you're getting it from a box? Yeah,
like I wanted to know who's the motherfucker picking up these boxes, testing these boxes.
Right. Or from your clothing too. Because like for me, ever since COVID happened, for me, when I would get home, instantly I would I'd strip my clothes at the door, throw them outside, and just take a shower.
Oh shit.
Yeah, that was that strict. Like, all my work shoes are in my car. Like, they don't come in my house.
So, dang, that is true, huh? Because then you have to set up a protocol for even going home.
Yeah, it was bad, dude. Like, it was really bad. I didn't even let my niece and nephew come over, or I didn't even see them for...
That fucking blows.
Like I want to say like 4 months I didn't see him because I was like, no,
Until they started
getting...
saying, okay, it's not as bad, but it was still
not even that. It was just, I was, as time grew or went by, excuse me, I was more like I've always been precautious, but I was like, yo, for my sanity, like I need to see them because I was slowly losing my mind. Like I went to a deep state of depression.
Losing, lost, been, all words. They're all words. All words. It's okay.
It's just, it was a really lonely time.
Oh, for everybody, right?
Yeah, but everybody. It was lonely.
I can like, it's a different story when they say shelter in place, but you can't, right? You have to go to work every single fucking day, no choice, or quit, right? But there's people who had extreme choices, right? Like I'm pretty sure you might have heard about the nurse who took her own life because she didn't want to expose any of her family when she found out she was COVID positive.
Yeah, it's
fucking sad.
It is.
Right? And it's like, okay, you have to think about the psychology of the people who are working, right? Like when I first started hearing about this, I'm like, how do you process that? How do you go about going, okay, at that point in time when all this was going on, it was like, you catch it, you die.
Yeah.
Like if you have a reaction to it, you're going to be on a ventilator. There's a good chance you're going to die. This is before you knew jack shit about anything. And then you hear about nurses, doctors quitting, going, no, I'm not taking this risk with my life, my friends' lives, my family's lives. Fuck this. And they quit.
Yeah, because they weren't giving proper PPE. Like, if you're going to give me like a regular surgical mask and be like, oh, hey,
good luck,
positive wing, like have fun.
Oh,
I
no.
like, fuck you. Like,
were hospitals doing that?
No, yeah.
Yeah?
Yeah. There was a lot of people on, nurses on TikTok that actually, made a segment. They're like, you know what? This is what my boss asked me to do, and I'm immune and compromised and stuff like that. Like, no, I quit. Like, I'm not going to put my life or my children's life.
That's fucking horrible.
Dude, it is. Like,
because, what was high risk is anybody who,
even the healthiest ones were dying.
Even because athletes were getting it and getting fucked up for months at a time.
I mean, they are around other people, and like it's like a chain reaction. Like
it's definitely fucking weird because I'm not a medical expert and this is not medical advice, right? But in my personal knowledge, I can't think of a disease off the top of my head that's this infectious, that's this easily manipulated, or not manipulated, but like mutated, because we got a different strain than China got. And then like England got a different strain than we got. And it just keeps changing and it keeps
mutating.
Yeah. And not just that, the fucking side effects are weird. They're like all over the fucking place. Some of it is bullshit from the news.
Yeah, no, yeah.
But some of it was like fucking like you get like blood clots.
That I'm not sure from COVID, but from the vaccine, I've heard about that.
Well, I heard it was.
I'm not sure about the blood clot.
I read. I don't know how CNBC. Who knows? There were so many articles that came out every single day. I heard you got blood clots. What is it? Loss of taste, a loss of smell.
Yeah.
What else? Breathing issues, heart issues, which was weird, but I guess. But this is supposed to be like a really contagious cold, but it has all these really weird side effects, and no one can really figure out what it wants to do. It just does a little bit of everything.
Yeah.
Like, what the fuck is that?
Exactly.
But it's supposed to be like another strain of a virus that already exists, and none of those other viruses do that. Right. It was really strange to me. I was like, what the fuck is this? And I'm assuming to you guys got the first letters and be like, wait, so you can catch A, B, C, and D, and E, and Z, and what the fuck is this? It's not even a letter that you can.
Yeah. And even now it's like,
still
last
crazy.
year I was like, this is going to be like the flu, but like, a little bit deadlier.
A little might kill you more.
So, and everybody was like, oh, it's a conspiracy and blah, blah, blah. I was like, okay, yeah, sure. Why not? Whatever.
We can go there.
It
can go there.
But with the whole like vaccines, they're like, oh yeah, they're tracking us and
microchips.
I was like, man, First of all, fuck you guys. Like they're tracking you on your phone right now. So
Yes.
they've been tracking us. So get over yourself.
This is
A magnet in your arm? Okay.
Yeah. Okay. Let's just think about it logically, right? If we had the fucking technology to inject people with something that was a tracker, do you think they would tell you?
Duh. No.
Right?
Like,
You would just wake up. They would just be like, oh, huh. Why am I in this room? Oh, and
exactly.
then it was a dream,
Like
but everybody,
Resident Evil?
you're just going
Right?
to, you're not going to know about it.
Exactly.
I think it's really strange. People, I don't understand where that came from. I don't know where the whole magnet thing came from.
I have no idea.
It is really
either.
strange. I'm not going to lie. I did see a couple videos and I'm like, that's suspicious. But then again, this is TikTok. I'm not going to believe science fact from a TikTok that's only 60 seconds long of some lady going, look, a magnet sticks to my arm now. Wait, what? Bitch, did you shower today?
And then the next question is like, okay, maybe it sticks to your arm because you probably have like some screws or some sort of metal in there already. Do you know what I'm saying? That people could
I don't know
manipulate
how.
it.
Okay, I was this kid. Did you ever try to put a spoon on your nose? Where you just like didn't do anything to it, just put it on your nose flat and see if it would stay. And then like 1 out of 10 times it just stayed for no fucking reason.
I mean, I tried it and then I got over it because it wouldn't stay on.
Right?
Fuck it,
So
yeah.
I have a feeling those people who managed to get it to stick were those kids. I'm just going to say it now. They're just like, let me put this magnet. Oh my God, it sticks. But then the little tinfoil hat person in me goes, what if no? Then okay, so if you let it, right, the TikTok algorithm is a bitch because it's really good.
I literally do not use TikTok. I don't even.
You're not missing much. Just a bunch
I
of.
know I'm not.
But the algorithm is the best I've ever seen. It's better than Facebook's. It's better than YouTube's. It's better than any algorithm I've ever fucking seen. If you like puppies, it will fucking show you puppies. Not just puppies, the puppies that you like.
Nah, I'm cool. I don't like dogs.
But you get what I'm saying.
Yeah, I know.
If
Yeah,
you
for
like
sure.
big hairy men, I guarantee your feed will be a bunch of big hairy men. You only gotta like 2 of those motherfuckers, and then you're just like, what the fuck? This is suspicious. So I'm not gonna lie, I liked a couple of those conspiracy theories because I like to listen. So there was a guy who brought up the fact that very logical point. He was like, why would, if they're gonna track you, why the fuck are they gonna tell you? I'm like, good. Exactly.
Yeah.
Right? He goes, it's not gonna be in a shot, it's in the meat. I was like, wait, what? What? You had me and now you lost me. Explain. So he goes, I shit you not. Such a hard turn in the last 10 seconds of that video. He had me. I was like, exactly. Finally, somebody with some logic. And then he's like, look, a magnet. And he just lets it go and it sticks to the fucking piece of brisket. And I was like, son of a bitch. How'd you do that? I was like, wait. God damn it. I watched that shit like 6 times. I was like, okay, how do I break this down logically, right? Because that's the difference between someone who's gullible and stupid
Yeah.
and someone who actually has some common sense. So I was like, okay, let's just say, what if that piece of metal that I was assuming to be a magnet isn't the magnet, it's just a chunk of metal, and the real magnet is behind that meat, right?
Right.
You let go a piece of metal in front of some meat that's covered up by a magnet or vice versa. The piece of metal is going to shoot to that fucking piece of meat. I was like, okay, I'm not crazy. I know I'm not crazy. That's not real. Let me just government implanting tracker in meat. I was like, okay, Google, don't fuck with me now.
Oh my God.
I know it was bad. I did it. I couldn't find anything. Thank God, or else I might have lost my mind a little bit. But
Would that make you a vegetarian or something?
no,
Or
fuck no. I'd still eat meat. They could track me all they fucking want. I don't give a fuck. Meat is too goddamn good. You can know where I'm eating it. What are they like? What the fuck? Okay, why are people so scared of being tracked? I don't understand it.
I don't understand it either because they're being tracked every fucking day, every single day. Like
my
your
question
phone.
is, in 2003,
Mm-hmm.
George Bush passed that the Patriots Act. I don't know if you remember. No?
Yeah, that's a blur.
Okay. Quick reminder. the towers fell, right?
Okay.
Yeah, 2001. And about 2002 or 2003, the Patriots Act went through. I want to say it was like 2002. Basically gave the government all the rights to look through your phone records, through basically spy on you in any which way they can, under the guise of stopping terrorism, right? No one gave a fuck saying, oh yeah, you can look at my mail, you can look at my phone history, you can look at my web browser. No one gave a fuck. But someone gives you a vaccine and someone says they might be tracking you. Now you give a fuck?
Yeah.
How the fuck does that work? I don't know.
I don't know, dude.
It boggles my mind.
Your guess is as good as mine. I'm just like, yo, I just broke here, dude. Like,
do you have people coming in to try to get the trackers removed?
They just tell me they don't want to be tracked. I'm like, okay, cool.
Do you fuck with them and be like, okay, dude, I'm just going to hook you up this one time, all right? Let me see your arm. Doot, doot.
I should, huh? No, but
you really should. Just take that little fucking finger thingy that you guys have for the pulse and be like, give me your finger, take it off. No one knows that this does this. Just between you and me. And just be like, boop.
Dude, I would get
It's off.
fired.
It's off. What are they going to come back to? Be like, it didn't work. They're still tracking me. What are they going to do? What are they going to tell you? Come on. They'd be like, or you could just be like, that dude's clearly fucking crazy. Come on. What, a fucking heart rate meter is going to stop a tracker? Like, what the fuck? What kind of crazy shit is this? Come on, guy. You should try it. That would be me. I'm an evil, sadistic bastard, though.
No, I can't do that.
Hey, it's just a play in the book. It's all right.
It's a thought. I'll keep that in mind. I'm not going to lie.
But do you legit get people to ask for the tracking removed?
No, because the demographic that I work with, they're not like...
they're not all crazy and shit.
Well, I wouldn't say that, but they're not like as educated as, like middle class are. So I work with low income family.
They're not worried about tracking.
Honestly, no. They're like, shoot me up. And I'm like, right? Okay, cool.
So strange.
Like,
right?
Some of them want it. Some of them are like, well, for what? I'm like, well, it's up to you, bro. Like, I don't fucking care. Like,
this whole thing is a fucking sketchy mess. So me personally, I'm not vaccinated yet, but I want to be. The thing is, I want to wait.
What are you waiting for?
I'm waiting for the technology to get better, right? There's a reason that there's a vaccine court, right? Because there's enough instances of a vaccine causing lethal or very negative side effects that the government put in place a court dedicated to settling those lawsuits.
Right.
Right.
However, we have the, I forgot what it's called, but if you had side effects, like depending on what side effects, you're supposed to report it. Like for instance, when I got my second dose, the pain radiated to my clavicle.
Ooh.
Yeah. I was like, what the fuck is going on? And then like, I know a couple other, my coworkers, some of them got like, weird like breast pain.
Oh.
Yeah. So I was like,
they're female, I'm assuming.
Yes.
Okay.
Yeah. Female. Yeah. The females, they got breast pain. So I don't know if it's the COVID vaccine or because,
that's strange. Okay. So you're supposed to report it, but okay. My thing is, since this is a government issued vaccine, the government is, I don't know if this is true. I need to research it. Don't take my word on it. But I heard that because the government is paying for the expedited delivery of these vaccines, these companies are no longer legally liable for anything that could happen. So if you got a vaccine through regular circumstances and the vaccine caused you like very significant side effects, you could sue that company for those side effects if they knew about it and didn't disclose it. Mm-hmm. Right. But in this instance, they don't know what the fuck's going to happen.
Right.
So they're not legally obliged to settle those issues. The government's supposed to handle that. But as of yet, no one knows what the government's going to do for people who do get shitty side effects. And you could be just one of those unlucky people who get shitty side effects. And then what? Right? So my point is, I could take it now and roll the dice.
Yeah.
And maybe I get side effects, maybe I don't. or I can wait till this vaccine gets a second version or a revised look at it after this whole thing goes through, because people are getting enlarged hearts or heart swelling, blood clots, apparently clavicle pain, and your chest pain. That's the first time I've heard of those.
I'm not sure, because I honestly, I really don't keep up to date with any of that shit. I'm being completely
that's just
honest.
me, because I actually want to get vaccinated, right? Because I want to go out and have fun. And I'm hearing that some private businesses and venues aren't allowing people to go if they don't have their full vaccine card, which is kind of fucked up.
It's so stupid.
It is.
Okay, because I got mine through my work. Mm. However, they're like, oh, we want it from the CDC. What? Dude, just look up the fucking lot number and everything like that. Boom, it's right there. But no, it has to be on from what I heard, it has to be on a CDC card. But I don't know.
That makes no fucking sense.
With this whole mask thing, it's like, oh yeah, if you're fully vaccinated, you don't have to wear a mask anymore. Blah 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 blah. Just all the things that I saw.
It's just so inconsistent.
So fucking stupid.
It's just the inconsistency, right? So I get it. We're learning as we go, right? Yeah. But to my point about getting vaccinated, if the technology can get better if I wait 6 months, I'd rather wait, right? If there's a larger test group after this whole thing, after we reopen, right, and people start enjoying the ability to being vaccinated, then I'd rather wait till that data comes back, right? But I'm not against vaccines. I just think I want to wait. And I think it's okay if you wait. I think you're fucking retarded. No offense. If you don't want to get vaccinated, and you can be.
Yeah, just some people just don't believe in vaccines, or some. I love you, fam, but my
oh no, are they in the nursing field also?
No, it's myself and my little cousin. We're the only people that are in the medical field. Was it
one of your friends that's just like, nah, man, I don't want that tracker?
No, just my I love my brother. I'm sorry. I'm sorry, bro. I fucking love you. But anyhow,
he doesn't want the 5G, man.
Put you on blast right now. He this whole time he was like, the blood of Christ, the blood of Christ. I'm like, all right, bro.
Oh, he's religious.
Yeah. Oh. And I'm like, all right, no, dude, I totally understand. However, I believe in science as well too. So
okay, Nacho Libre.
And
I'm a man of science.
Get that cone out of my face. I'm pretty sure that's how he is when I'm stating facts to him, and he was like, get that shit in my face. So yeah, he's not getting it. He doesn't want my mom to get it. And I'm like, look, first of all, that's mom's decision.
Right.
She should be getting it because
especially if she's high risk.
Yeah. My mom is completely high risk. All these things that's, she has stage 3 renal failure. She's diabetic. She's, she's considered to be overweight and stuff like that. So she has all these, issues. And it's like, look, I would feel bad if someone had COVID and gave it to you, and then you'd be hooked up to a vent, mom, just because, you're not taking this seriously. And I was just talking to her about it and stuff like that. And then I called my brother, and he was all like, well, apparently you made her an appointment. And I was like, I'm sorry, I don't have access to fucking Kaiser. I didn't make her an appointment. I was trying to see, if you guys wanted it, you guys could come down to me, and I could see what I could do to get you guys vaccinated. But
I guess to each their own. It's their body, right? It's America. No, yeah. They can choose to not have the vaccine until it's mandatory.
Yeah. So, what is it? I know for universities, kids that are going into universities, they had to be vaccinated.
That's so sketchy, right? Okay. I'm for vaccines. I just said that. I want to wait. But here's where the line gets blurry. I lived through the time where our liberties got taken away because we voted it away. Mm-hmm. We allowed the government to spy on us. We'd said it's cool as long as you protect us. And then everybody forgot. Now we have this instance where the government is protecting us at the cost of small liberties, right?
Yeah.
When you have to wear a face covering, right? This is all protection, right? It's rules to protect everybody else, but they're telling you what you can and cannot do. And they've always done this, but it's never been to the point where they're like, if you don't cover your face, you don't get to go out.
Yeah.
That seems kind of scary, right? If I told you this a year and a half ago, right? If I told you, hey, Krystal, if you go out without covering your face, someone else is going to scream at you and tell you, hey, don't you care about other people's lives? And you'd be like, wait, what the fuck?
I would say no. No, I'm just kidding. I care about everybody, but
you know what I'm saying?
Yeah, no,
it's
no,
really,
sure.
it's like,
yeah.
it's weird territory. And now it's sort of like, okay, cool. They're going to reopen the United States soon. Most places are reopened.
Dude, it depends on the county too. Like,
So fucking weird.
I love my county, but like we're
Sketchy.
Just some people they don't know boundaries.
They don't give a fuck.
Exactly. So I went to the beach the other day and nobody had anything on, which, I'm like, I'm all right. That's cool because we're out in the open or whatever, But
because sunlight kills it, supposedly.
I have no fucking idea. So I'm pretty sure if you injecting bleach, it'll kill it too. So
I'm pretty sure Trump was right. Yes.
do not do that. I'm not advising anybody to do that. Okay?
This is not medical advice. I don't know what I'm talking about clearly, and she is joking. Stop it. But I'm pretty sure he was right. You just inject a little bleach, you'll be fine.
Or that UV light, he said.
Yeah, get a little UV light in you, man.
Lube it up.
I'm pretty sure he was just scared of vampires. I think that's what he was going for. He's like, I'm gonna fuck these vampires up. That dude is cracked out. I guarantee he was like, if I tell people to take UV light, the vampires are all gonna die. I guarantee you that was his thought process.
I'm pretty sure he was like,
I saw that interview. It was hilarious because his aide was like, what?
Wait,
what?
Which,
the bleach. Yeah, we'll totally look into the bleach. What the fuck are you doing, bro?
No,
Don't tell people to get bleach.
It was really bad when I saw it. I was like, oh,
I'm not a Trump fan, but it was comedy. I loved it. It was hilarious. It was hilarious.
And people actually did it. They actually.
No way.
Yes.
Get the shit for real?
No, I'm dead serious. Yes. A lot of people.
God rest their souls. Wait, did they die?
No, I don't know if they died or anything.
I mean,
but like, I know, right? But Poison Control Day, it was called. They reported 120 something cases up in New York. I don't know about here, but I heard that in New York at the time when he said it, it was like 120.
I don't know how to feel about that.
First of all, where are you getting these needles from, and where are you getting? You get what I'm saying? Are you inhaling it? Are you drinking it? What are you doing?
That's a good, because he just said get it in you, right?
Yeah.
He said just get some bleach in there. I could you know what? I'm gonna look that up because I don't want to misquote ex-President Trump. Trump bleach.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, you can.
Oh yeah, it was the light to bring the lights inside the body
in some other way. And I think you said you're going to test that too.
Yeah, they're going to test that. They're going to test that.
And then I see the disinfectant.
I'll get some
knocks it out in a minute.
Some disinfectant knocks it out in a minute.
We can do something like that
In the body, right?
In the body. Let's double check. I think he.
Let me inhale some of my Lysol that I have
in a minute.
In my purse.
1 minute. And is there a way we can do something like that by injection inside or?
Oh yeah, in the body. Some disinfectant.
It gets on the lungs and
in the body.
a tremendous number of the lungs.
So CDC must have been getting all kinds of people doing all kinds of stuff to get it in the body.
Yeah. No. Yeah.
So they might have inhaled it. They might have drank it. They probably swished with it, and
When I heard about that, I was like, "What the fuck?"
Oh my god!
I'm not gonna lie. Okay, so this is what happened. Before this happened, I was lazy at the time, and I was like, you know what? Let me shower and clean my bathroom at the same time.
Mm-hmm.
I was an idiot. I had should never take my own advice. So I sprayed Clorox, right? And then I turned on the shower, all the chemicals rose, and I was such a fucking dumbass. I was like, oh shit,
I'm high.
Yeah, I know. So I'm like, all right. So I called poison control. I was like, yo, I fucked up. And I was just telling them, my son was like, yeah, just my chest hurts. Just.
That's fucked up. Did they laugh? Did they giggle?
They giggled a bit. I'm like, this is not.
Did you start off with, I'm a nurse?
No, I actually did. I was like, look, I'm a nurse and I'm pretty sure I fucked up. And at least
just to give yourself some credibility, just to be like, I'm not a total idiot. Okay, guys, I just made a mistake.
Oh my God. Like the next day I was having like a little bit of chest pain. I'm like, I'm not telling anybody I have chest pain like that, but yeah, it kind of hurt. And they're like, yeah, and as long as you're not throwing up blood. I'm like, I was, in the shower for like 5 seconds when it hit me and I was like, fuck, I got to get out.
Oh no.
Yeah.
But you were just taking Trumps and virus, just get in you. This kills the virus.
This was prior. Okay.
Oh, so you were ahead of the curve.
I'm pretty sure it was.
You're ahead of the curve. See, he probably got it from you. He probably like, Krystal knows what's up.
He got it from my phone when I called poison control.
And he was probably like looking through some stuff and he's like, oh, this girl knows what's cracking.
She's like, oh, clean your bathroom and shower at the same time you use bleach. Put it in the shower. Wash yourself on your shower.
Oh my God.
Yeah, I know. I'm not the smartest.
It's okay. Not everybody has common sense. There was somebody who fucking drank bleach. Come on now.
Yeah.
Come on. That's so bad. If my president if he specifically said to drink bleach, I'd be like, man, you got me.
That's your president, though.
You got me. I'm Mexican, homie. I don't know what the fuck's going on. You got to convince me that you're my president. So everybody else voted for you. I don't know if I did. If I did, you got to convince me to drink this bleach. Is it coming in taco form? What's going on?
Maybe it's not bleach. Maybe it's Fabuloso. You never know.
Ooh, dang. Fabuloso does taste pretty good. Have you smelled Fabuloso?
It smells like garbage. I'm sorry, everybody. I do not like
you
Fabuloso.
Racist bitch.
It's not even that. No, like.
What are you, a Mr. Clean with his white Aryan bald head? Is that what you use?
Yes, I do.
Oh my God! It's because he's white.
Oh God, no.
So what do you use?
I use bleach. Honestly, I don't like the smell of Fabuloso.
You don't like? Oh, what about pine sol?
Not really.
So do you not like it smelling nice?
It smells like bleach.
That's disgusting.
That's not disgusting.
That's horrible.
Like what is the purple brand of Fabuloso? Like that's
Fabuloso.
That smells disgusting. Like straight up. Like I used to hate it. I used to hate cleaning with Fabuloso.
You know what? You probably had a traumatic experience cleaning with Mexican or Latin American people. Is that what happened?
I don't know.
Did someone smack you because you didn't clean something right?
No, just the smell smells horrible. I don't know.
I guess. I like Fabuloso. Me personally, pine sol. I prefer pine sol.
Really?
Yeah. Pine sol smells like fucking pine trees. They don't have pine trees out here. I'm in the ghetto, homie. This is the only pine trees I'm going to fucking smell. You feel me? I was just being honest. There's some rich white person right now who's like, real pine trees. Yes. I'm over here fucking, one day I'll smell real pine trees.
You have like the scented candles. Let me just, let me live my life.
You know what? I'll be honest with you. It probably doesn't even really smell like pine trees. That's what I was just trained to think it smells like. I'm just being completely honest.
Probably.
I'll probably go into the forest and be like, this doesn't smell like pine sol. I'm just being completely honest. That's how you know you're poor. You don't even know what real pine trees smell like. It's okay. It happens. Not everybody is privileged. Yeah, man. The Trump thing is crazy as fuck.
Yo, it really was. I was like, people are really listening to his advice?
Yeah, man. They're okay. I give it to Trump people because they are dedicated. They might be racist as fuck, but damn, they are dedicated. Biden people are wishy-washy.
Oh, God. Don't get me started about that.
Look, I hate
Just
politics.
don't.
I hate politics.
Just don't.
I'm not political, but it is amazing that a dude that I used to watch on celebrity. What was it called? The celebrity boss movie. What the fuck was it?
Apprentice.
Yes, this dude who's on Apprentice is fucking our president now, and people love him.
My dad actually met his wife. His ex-wife, excuse me, Ivana Trump.
Isn't that the one that he's with now?
No, it's Milana.
Oh wow, that's super similar.
So this was
So I'm assuming he imported her also from the same place.
Pretty sure, yeah.
Oh, okay.
Yeah. But yeah, no, my dad said that she was like a lovely lady.
Oh, she's nice.
Yeah.
Did she say anything nice about him?
About Trump? I'm pretty sure no.
No, he's like that motherfucker. Back in my homeland. I'm pretty sure that's more or less how it started.
Perhaps.
I don't know. I just think Trump people are very dedicated. I love their.
No, they are. Like in the neighborhood, there's actually this house because I live in a cul-de-sac area, and there's a house and it says "fuck Biden."
Damn.
Like you would be the house that was the trashiest of the trashiest in our whole entire, like in our whole entire block area. Like it's your typical. I like trucks.
Talking to a big lifted truck.
Yes,
big ass tires.
Trucks. Just the whole place. I was like, you make us look bad. Like, can you just go to a different like neighborhood? Because like, okay, so I've been living in Orange County for like 14 years. And I want to say over the past like maybe 10 years, it's been becoming more diverse. So in my neighborhood, it used to be predominantly Caucasian.
No.
He had some Hispanic.
Really?
You know that?
Yeah.
So, no, like we've now like my, the entire block, it's very diverse, very colorful. You know, I didn't see, African-American people until like 4 or 5 years ago.
Really?
And in my particular street that I'd go down. Yeah. There's like maybe like 2, I think they're an African-American family that live over there. Yeah.
And they're not Trump people.
Oh, I have no idea. It's not like, hey, are you for Trump? But it kind of reminds me of a little bit of the series called Them. Have you seen it?
Mm-mm.
Okay.
Why? What is it?
It's like based about like how in the 1950s, how I don't want to say slaves, but people who were African Americans who were living in Louisiana, Kentucky area, they came over to California. Mm-hmm. I believe it's either Watts or Compton. And
sounds about right.
In that time, it was predominantly white. So this guy,
probably Compton.
Yeah, so I think it was Compton. So this guy, he came over with his family. He was an engineer, and they wanted him out. Him and his family. It gets pretty deep, and
sounds like some Klan shit is about to happen.
I had to like stop watching it for a couple of
that bad
weeks. Yeah, like
did it bother you?
It did.
Like, hate you?
It actually did, just because of everything that's been going on too, as well.
Was there like some why specifically? What was going on?
Well, specifically, there's one episode where, these Caucasian people, they're taunting them or whatever, and they put a baby in a pillowcase, and they were just swinging it around.
What?
Throwing it. It's called Cat in the Bag.
What?
Yeah.
1, that's fucked up. 2, who named it? And 3, why Cat in a Bag?
Yeah, I don't know. But yeah, no. I was talking to my brother about this, and he was like, yeah, that was a thing. I was like, what the fuck? Because like...
So, not to get into too much detail, but did they break into people's houses to do that? Or like, would they see like a mother pushing a stroller and then just yank the baby? Like, what the fuck?
They saw that, they noticed that her husband went into town and it was just her and her baby. So that's when they saw that she was vulnerable. And that's when they
that's fucked up.
Yeah.
And that's fucked up.
And like
I kind of want to see this.
It's an interesting show. And
should I Google that? No, that is going to be on my algorithm. I probably won't Google that. Yeah, that's probably not a good idea. No, that's probably not. No. I have a feeling I'm going to try to look up this clip. And I'm not going to get the clip. You feel me?
Yeah.
Let's not go there.
It's probably going to be like an actual Cat in the Bag.
I don't know, man. Google be doing some racist shit sometimes. Like you'll be like, wait, what is this? I'm like, well, that's not me. I'm brown. So that sounds fucked up as shit.
Yeah, no, and honestly, I haven't been watching like any of the news or anything like that lately. Or
Yeah, because of your mental health. Fuck all that.
yeah, no, yeah, definitely, and especially what happened last year with George Floyd. That really messed me up. Like,
Strangely, I almost forgot about that, but that was big. That was like huge.
it was Memorial Day weekend.
Yeah.
Yeah.
Like, I want to say I went a solid like 3 months without watching the video. Like I saw the news, right? Because sadly to say, a black person getting shot or killed by the cops it's not anything new.
Right.
Like, it's just, you see it. So I kind of didn't pay attention to it. And then it kept popping up on my feed. I'm like, how bad could this possibly get that every time I scroll down, I see an article or someone mentioning it.
Mm-hmm.
I'm like, it must have been bad, because colored people die at the hands of the cops all the time.
Mm-hmm.
So for my feed, like 3 months later, to be still nonstop, I finally clicked it and I watched it. And it was bad. As a colored person, I feel like that could have been anybody. It was extraneous. The circumstances were bad to begin with, right?
Mm-hmm.
But there was no reason for it.
There was no reason, and just the whole thing in itself was like, you guys wanted to cover this up. Like, I even saw the person with the stretcher. It was a cop.
Really?
Yeah, you didn't see it?
I didn't get that far. I saw the act and then, well, him passing away. And then I was like, okay, I've seen enough. I didn't get anything further than that.
Yeah, it was really bad.
And what, they legit tried to cover it up?
Yeah.
Oh, no shit.
Yeah. I think from what I was reading, what I was hearing, somebody from, I think the fire department was trying to come in and, assess the situation. It was a female, but the person who took George Floyd, I was a man, and you saw in his uniform, it said, wherever they're from, police department. And I'm like, wow, you're taking this man in the stretcher into the ambulance.
Yeah,
So
sketchy.
I was like,
well, I do have something to say about that, right? Well, your family came from law enforcement, right? So you kind of, you might have seen like how it is, right? Like your dad probably said stuff or.
To be completely honest, like my growing up, I saw no color just because, even though I am adopted, we come from like a very diverse family. So there's Hispanic, Korean, Caucasian, you name it. We're all up in there.
Did your dad ever like explain to you like it's a brotherhood? It's not a job.
No.
And never really like, you never saw like his coworkers come over for barbecues or like him being really tight with.
No, my dad actually didn't. He only had maybe like 2-3 close friends.
That were his coworkers.
Yeah.
Right.
That worked with him in the police department because my dad had to retire early. So he had a heart attack. So it was like his second heart attack on the job.
Oh,
so they had to force him to retire early. But we were never like
a big police family.
Not like that, but we were never like, oh, the cops need to do this. You need to listen to this. My dad was all about just being rational. My dad was not like, oh, he never saw color. He just saw the action or whatever and would deal with the situation. Like we lived, even though we lived in a good neighborhood or whatever, there were still, your bad apples, whatever.
Right.
We lived next to gang members, and we had this rapport with them, and
usually they don't fuck with you if you don't fuck with them.
Oh yeah, and my dad actually he helped counsel them because they were going to court and everything like that, and they saw that my dad was a good man, and he gave advice to people like, hey, what are you doing? Like, you need to stop fucking up because this is what can happen. This is, you want more years on your probation or whatever.
See, that's good though.
So yeah, my dad, he was that was the type of man my dad was. He was like, you know, when he would give advice, it's like you either take it or you just, you know.
See, but that's a side of the coin that most people don't hear about that exists, right?
Yeah.
The good side.
Everybody's just so focused on the bad side. Yeah.
The problem is that the police departments pretend that it doesn't exist.
Yeah.
That's when it's an issue, right? Because I get it from both perspectives. Because I have friends who are cops. For the longest time, I worked in security, which is as close to law enforcement as you can get without being law enforcement, right?
Yeah.
So the job, you're risking your life every time you go to work, right? It's stressful, right? You have to deal with people who are breaking the law, and it's your job to enforce it, right? You're ruining some people's lives because of their dumb decision, right? But it's your job to enforce these laws, right? So my family has told me stories of like how the police have changed, right? How they don't have a relationship with their community anymore. Like it's just a job.
Yeah, I feel like they don't anymore, to be
right?
completely honest.
Because before it was like you kind of knew the police officers who worked in your area. And if, let's say, I don't know, Joe Blow has an issue with his wife, you knew the police officer who might be coming to your house to arrest you for this altercation. And he might see it within his rights to counsel you.
Yeah.
Right? Make sure you don't do it again and give you these options and give you a break. Where now it's just a job to them. If they don't abide by the rules and check certain boxes, it's their ass. So they're going to choose you over them. And that sucks. But the flip side of that coin is this job's hard and they deal with dumb fucks all day long. Like some people get to deal with knuckleheads once in a while in any industry, right? Their job is to deal with only dumb fucks all the fucking time. The problem with that is that at some point, you're going to be put in a situation that no one wants to be in, right?
Yeah.
And especially if you don't work in a nice neighborhood or if you don't work in a good area, if your beat is in 1980s Compton, right?
Yeah.
You're going to be running into drug dealers. You're going to be running into like gangbangers. You're going to be doing all kinds of shit that you probably don't want to be doing. And then at the end of the day, you have two choices: enforce the law and go home, or don't go home.
Yeah.
And a lot of people are going to choose to go home. And that ends up taking someone else's life, right? That could be going to jail, could be hurting them, whatever. And a lot of cops break under the pressure, right? Because of the stress. So in my last job, I was under constant stress and I noticed my job was affecting me on a psychological level, right? You can only work so many hours a day under so much stress until your body and your psychology changes, right?
Yeah.
So if you're sleeping 6 hours a day and then constantly under stress, you're going to go home trying to find any way to relieve that stress. And if someone brings you back into that cycle, you're going to be really fucking mad, right? Something really dumb, like your wife tells you to wash the dishes, right? Something ridiculous. Or you forgot to pay a bill. Stupid shit like that. I've seen cops who are my friends have a short fuse when I met them a few years ago. They were never like that. And I've asked them, like, what happened? They're like, it's just the job. Like, I don't mean to do it. It's just like, I'm on edge. I'm like, okay, bro. I'm like, seek some help. Right. But they don't because, I don't know, they're a guy. It's the job. I don't know. And it's shitty.
And they do offer counseling too.
How many people take it?
You know, they should start taking it more. And I feel as if, you know, just because you're labeled as law enforcement and because you're a man, that you need to man up. I don't even know what that means, honestly. But yeah, like if Yo, if you're throwing me free therapy, hell yeah, I'm gonna take it. Like, you know how much therapy is?
Yeah, but okay. So there, how do I put this? You don't want to be seen as the weak link, right? Because you rely on your coworkers to have your back, right?
Mm-hmm.
That's where that whole idea of brotherhood comes from, right? Not all of them are going to be doing sketchy shit. Some people are just on the up and up. But let's say you get put in a shitty situation, right? You've been on the beat for whatever long. You have a partner. He has your back. You have his back, right? Shit hits the fan.
Mm-hmm.
At that point in time, it's just you, him, and whatever the fuck is going on. Nothing else, right? Some people will be on the up and up and make the right decision to follow the rules, follow the law, and follow the regulations that you need to.
Yeah.
And everything works out accordingly. And then there's the cops that don't, right? I have a strenuous relationship with police officers. I'll tell you a quick story. I'm a little Mexican boy, right? I work security. I worked for this nice little old lady who was my manager. And in our security booth, there was a mini fridge, right? The ice machine always iced over, always. So for me to put my food in there, I would have to like pick it out and clean out a nice little section of it, put my food in there, and then later on reheat it. So on one of those, I accidentally hit the Freon vein that was there and leaked out all the Freon, and the ice maker was dead. I felt so bad because she bought it with her own money, right? So I felt like a dick. And I told her, I was like, look, I'll get you a new one. Don't worry about it. So go on Craigslist, right? Like any other broke kid would do. And I found another mini fridge for like $60 in Victorville. I was like, cool. I'm still in uniform. It says Securitas on my badge, right? Because that's the company that I used to work for. And I went up the hill. I met up with the guy. I hooked it up to the power. It worked fine. Got cold. Cool. Gave him money, picked it up, threw it into my car, and left. It was about, I want to say, less than a week. And I came home to both my doors knocked off the hinges and my entire place destroyed. My first thought was I got robbed, right? Someone did a dropped the door, stole everything, right? So my first instinct is they might still be here. So I cleared the house. There was nobody there. And then I started realizing they didn't take anything, right? All my jewelry, all my stuff, and I even had some weed that I had. They didn't take any of it. They didn't take nothing. And I was like, what the fuck? What kind of fucked up robbery is this? Right? So then I look under my dining table and I find a search warrant. Yeah. So I'm like, wait, what the fuck? So
don't you have to be present?
No, apparently. But check this out. I found out a whole bunch of laws that you're supposed to follow that no one followed. So apparently, for a search and seizure, you do have to be present. But if they're looking for stolen items, they don't have to be. Like, you don't have to be present.
Well, that makes sense because, like,
yeah, it's stolen items, right? So, but all right, so let me continue because this story gets fucked up. So I see the search warrant. I fucking lose my shit, right? Because I'm already broke as it is. Now I have to replace 2 doors, explain to my roommate why the fuck all her shit is all over the ground. So I call the police, our police department. I'm like, hey, I just got home. My house is destroyed and there's a search warrant on the ground. And they're like, we know nothing about that. I was like, what the fuck do you mean you don't know anything about that? You're the police department. It had to be you guys. They're like, well, give us the number on the search warrant. And they're like, oh, it was Victorville PD that was in collaboration with Rialto PD that knocked down your door. I was like, so you're telling me that the Victorville Police Department came down, hooked up with you guys to knock down my door. You guys aren't telling me why. What the fuck is going on? And they're like, we don't know. but we can give you the detective's number who's on this case. I was like, there's a detective? Yeah, give me his number. So they gave me the number, and it was the number to the Victorville Police Department, which I was like, this isn't his number. This is the fucking police department. So I called. I was like, hey, give them the same fucking story. And they're like, oh, yeah, we'll transfer you over right now. So I called. I'm like, hey, who the fuck is this? And I'm not going to say this asshole's name, but he told me his name. I was like, hey, well, this is Annabelle. And he's like, oh, really? I was like, yeah. Did you just come to my house? He's like, yes. Where are you? I was like, I'm at my house. He goes, okay, good. No. I know where this is going. I'll come to you. He goes, what? I was like, I'll come to you. Where are you? He goes, at the police department. I was like, cool. I'm going up there. Give me their address. And he's like, okay, yeah, I'll wait. I was like, great. I'll get my things. I'll be up there in a minute. He goes, interesting. Okay. This is the first time I ever had a criminal come to me. I was like, oh, I'm a criminal. Cool. So I get in my car. I drive up to Victorville. Apparently he was off after he raided my house. He was just bullshitting when I called him. He was at the office bullshitting, enjoying his fucking day with my house destroyed because he was already supposed to clock out. Yeah. But he's never had anybody fucking call him to talk to him after he fucking raided somebody's house who's supposedly a fucking fugitive. Right? I didn't know I was a fugitive until I got there. Right? So me and my roommate go trying to figure out what the fuck is going on. Apparently there's a search warrant and a warrant out for my arrest. Yeah. How I got a warrant, I have no fucking idea because here's the kicker. They managed to get a search warrant from a judge under false accusations, right? So on the warrant, it said that they knew that I stole certain things. And that's the stuff that they brought to the judge when they were still investigating. But they're like, ooh, this nice little brown boy was seen putting stuff in a car that same day. So I find this out later. I go up there, I talk to him, and they kind of like locked me in as soon as I walked into the police department. So a police officer is like, oh, are you Mr. Mendoza? Yeah, sit here. Give me 1 second. Another officer came out and then they searched me. And I was like, what the fuck? I'm here to talk to you guys. I came here willingly. What the fuck makes you think I would bring anything? They're like, no, it's just a precaution. And they just seem real sketched out. Like, what the fuck? So my roommate's there and they separate us. And the detective like walks in. They put me in a room. They lock the door or whatever. I'm sitting there waiting and shit. Detective walks in. He's like, hey, Mr. Mendoza, how are you doing? I was like, I'm fucking pissed. He's like, huh. He goes, okay, so you're not under arrest yet. Why are you here? I was like, because I want to fucking talk to the asshole who broke down my door and why the fuck they did it. He goes, did you not reach the search warrant? We're looking for stolen property. I was like, is this over the fucking mini fridge? I was like, because I bought it off of Craigslist. If you would have knocked, I would have gave it to you.
Yeah.
And he's like, mini fridge? We're not looking for a mini fridge. I was like, then why the fuck did you knock down my door? He's like, well, we're looking for a laptop. We're looking for a couple of pair of socks, some underwear. And I was like, you knocked down my door for a laptop and some clothes. And there's a warrant out for my arrest under what? Because I don't have any of that. And I'm assuming you didn't find any of it. He goes, no. But we did find you at the scene of the crime the day it happened. I was like, you mean when I was buying the mini fridge? Because that's the only time I've ever been up to Victorville in the last 6 months. And he's looking dead at me, and I could tell he's psychoanalyzing me to see if I'm fucking lying to him. And I'm fucking mad. So he goes, oh, this kid might be telling the truth. And like I could see it on his face, like, oh, fuck. Mm-hmm. Because they skipped a couple steps, right? They didn't do enough investigative work to figure out that I stole some shit. I just happened to be there the day of, right? And I asked him, I was like, look, I'm gonna be straightforward with you. I didn't steal shit. You already searched my house, right? What else do you need from me? For me to get you to come off my back? I'll take you back to the place. If you can prove that you were there buying a fridge. I was like, okay, what do you want me to do? Knock on the same dude's door? Or if this guy exists, he'll recognize you, right? I was like, yeah. He goes, okay, let me show you a couple things. I was like, cool. He goes, he pulls out this nice little manila envelope, pulls out a picture. He's like, is this you putting some stuff into your car? I was like, yeah, the fucking mini fridge. He goes, okay, that's fine. That's okay. Is this you on the street? I was like, yes, picking up that fucking mini fridge. Like, these are the same pictures of me, like maybe 3 minutes before I walked up there. He goes, okay, well, the house that got burglarized is the one right next door. I was like, okay, so you're telling me you got a warrant, you knocked down my door because why? I was on the street and I bought something from someone next door, not there, next door. That seems like a stretch. He started to get mad. He goes, well, how do I know you didn't come back? I was like, well, shit, you have fucking photos of me. You know what I drive. Mm-hmm. He goes, you could have came in a different car. Maybe your roommate brought you. I was like, I'm pretty sure you know what she drives because you were at my house. So did they give a description of that vehicle? No. Maybe one of your friends brought you. I was like, okay. So you're telling me I bought a mini fridge there that same day that house got broken into. And then earlier that day, I broke into that house and then came back and bought that mini fridge. That makes no sense. He goes, no, but it doesn't have to make sense. I was like, oh.
It doesn't have, he said it doesn't have to make sense?
Yeah. I was like, wait, I see. Okay.
Interesting.
Now you're just trying to get it to stick and you're trying to catch me fucking up. I'm like, but I'm telling the truth, so I can't fuck it up. And then I realized, I'm like, oh, this is getting recorded. Duh. Okay. I was like, look, how about if we go back to that spot and you talk to the guy who sold me the mini fridge and then we can have this conversation again. That way I can prove to you that I was there only once that day because clearly you guys were staking out that house because you have photos of me. He goes, yeah, okay, that's fair. But if you don't, what then? I was like, take me to jail for stealing underwear and a laptop.
And some socks. Which the whole value of that was less than, I think $500, which is less than a felony. It's like a fucking ticket. It's a misdemeanor. They broke down my house and got a search warrant for me for like higher level warrants. Like it's really strange. They lied to the judge. We go and I've only been there once. All these houses look the fucking same. Right? So he just pulls up to the street and he goes, okay, find the house. I was like, shit. I didn't know what fucking house it was. I knew I'd been there once. I knew it was a house on this street. I was like, luckily for me, the owner went out and got his mail right as we're there. Right. I'm like, and he stops and he looks and he sees 3 patrol cars and then me kind of like going, I don't know. I was like, wait, that guy. I'm like, that's the guy. And he kind of goes, oh shit. He starts running back into his house. I would do the same. But they're like, excuse me, sir, wait. We need to talk to you. And then he pulls him aside. And I'm waiting next to another police officer. And I see him pull out like that little manila envelope. And he's like, look at this, look at that. And then he points at me, points back at the picture. And he points at him. And he points at the picture. And he like shakes his head. And he like makes this little hand gesture of like a box. And I was like, oh, he's telling him about the mini fridge. And he's like, come over here. He like waves me over. I walk over. I was like, what's up? He goes, all right, you're free to go. I was like, wait a second. What do you mean I'm free to go? He goes, you're free to go. I was like, what did he say? That you were here buying a mini fridge? Okay. So who the fuck's going to pay for my door? He goes, just be lucky I'm letting you go. I was like, wait, what the fuck? He goes, and don't give me any problems. I was like, no, fuck you. You broke down my door. I'm here in Victorville. I'm like, and you're fucking trying to get me arrested. I'm like, you lied to the judge about the shit that happened. You got this search warrant. I'm like, you guys better fucking do something about my door. He goes, talk to the city. I was like, oh, you piece of shit. And I told that to him and he got fucking mad. He goes, look, punk, you're lucky I'm letting you go. And I was like, all right, cool. So apparently it pissed him off a lot because
he ended up filing a charge against my roommate because all the stuff he found in my house for me was an illegal search and seizure, right? So he couldn't charge me with any of the weed. He couldn't charge me with anything, right? Because like anything he found, nothing, right? My roommate had a belt buckle that was in the shape of brass knuckles. California law says that if you have brass knuckles, it's felony, right? Well, he took pictures of those, of the belt buckle facing down without it showing the little nib and the loop. And she got summons to court for having an illegal weapon and this was found during an illegal search and seizure. And she had to pay a big ass fine or whatever the fuck. And it went through, right? Just because I wanted him to pay for my shit. And I was like, what the fuck? So, and that's not the only story I've had with like instances of a cop doing shady shit just because. And it's like, cops have the opportunity to do the right thing. They just sometimes choose not to for whatever reason. I don't know if it's just a bad day or that's what they're used to doing or it's the job. Because if it's the job, don't do the job. Go get a different career. Because if I wasn't an honest person and if I would have not watched what I said or watched how I said it, I could have easily ended up in jail for something I didn't do. And who the fuck is going to prove otherwise? Right?
Right.
Because if I would have said, I didn't do it cause I said so. And he's going to be like, well, shit, you're here, dummy. Done deal. I like, write them up, boys. We're done. Another book's closed. And then they have this nice little Latino boy fucking in the back. But I didn't steal nothing cause. Right? It's just because I was being honest and I know I didn't do anything wrong.
No.
But how many people were in that situation that are being honest, didn't do anything wrong and just talk to them wrong? Right? I don't know. I feel like if you're in that job, you shouldn't. I don't know. If it affects you to the point where you're going to be doing stupid shit like that, you should probably not have that job.
Or go on leave.
I don't know. I think once you compromise your morals, you should just be out. Right? Like if you find yourself doing some sketchy shit, right? Like I'm not going to say it was completely race-based, but just because I was a brown kid buying something on a white neighborhood that I've never been to and someone else fucking committed a crime there, they're like, we're done. Some brown kid fucking buying shit on this street after a robbery? It's got to be him. Explain otherwise. Like, please, like as a detective, not a police officer, a detective, which is one rung up, right?
Yeah.
You have to have deductive reasoning, right? What kind of deductive reasoning is that? That sounds hella racist to me.
No, yeah.
Right? But I don't know. I think once you compromise your morals in that job, you kind of need to bounce. Like, I don't think police should be policed as much as they are, but I do think that if there's enough complaints on a specific officer or deputy or detective, whatever, they need to bounce.
Oh yeah, most definitely. Like,
but that's not always the case.
Yeah.
So strange. But I think that comes back to like, they watch their own. That's so weird, right?
Not necessarily.
I think it's strange because there's like no other job that does that.
It's kind of like how the military is. They watch their own. That makes any sense.
Actually, yeah, that is a good point. The military does do that too.
See? And the military is pretty like racist. Like
I think they might be even better at sweeping shit under the rug.
Oh yeah, most definitely. My brother, when he was in the military, he was telling me about his stories and how
Got beat with soap.
No. I mean, he had to redo the swim test because he couldn't swim to survive. So.
Oh, because he sunk.
Yeah.
Okay, so there's a reason for that, right? So there's like a joke that black people can't swim, right? So black people and black men in particular are more dense. They're more, they're more dense. So they carry more muscle in percentage wise than most other people. Since muscle is more dense and less buoyant, they're more likely to not float. Mm-hmm. So they have to try harder to be buoyant. Because other people of other ethnicities, for whatever reason, don't carry as much dense muscle, so they're more buoyant. They carry more fat, so it's easier for them to be buoyant. So, I have a couple of Marine friends that told me that. I was like, really? Is that true? They're like, yeah. I'm like, black people can't swim. I was like, okay. I was like, what? They're like, it's just because, like, that's just the statistic. Like, for whatever reason, they're just more dense, so they don't float. I was like, that's fucked up. I was like, huh.
No, it's because you can't tread water.
Well, that's the thing, right? So if you need to tread water, right? If you're more buoyant than somebody else, you need to exert less effort.
Yeah.
Right? So I was like, oh, that does make sense. So if you're heavy, if you're not buoyant, you have to try harder to be as buoyant. So you get tired quicker, which makes it look like you can't swim as well.
That makes sense. Okay.
Right? And I was like, oh, that does make sense. I was like, so if you're fluffy, you float really well.
But then again, like, you have to meet a certain weight requirement.
Right.
But like, prior to you like getting out, that's a different story. Like,
so they made him retake his test?
Yeah.
And there was some type of racial underlining under that?
No, not necessarily. But he just said that, the military in general is just racist. Like, he had like honestly, like his, the people that he not hung out with, he associated with, it was split up into different categories, like blacks, Hispanics, whites.
Oh, really?
Yeah.
Was he in the Army?
He was in the Navy.
Navy.
Yeah, he was in the Navy.
What do they say about the Navy? I know they say that the Army people are dumb, basic Joes, right? I know Marines eat crayons. The Navy, what do they say about the Navy?
I have no idea.
I have a lot of military friends.
I mean, the Coast Guard doesn't do anything, do they? What does it say about the Coast Guard?
The Coast Guard is
nothing, right?
The Coast Guard is like the bottom. Okay, so
my friend's in the Coast Guard, and I'm like, you don't do shit.
So from my understanding, is like Special Forces, right? Marines, right? No. It's Special Forces, Air Force, Marines, Navy, Army, Coast Guard, and like weekend warriors. So
why would you put the Marines below Air Force?
The Air Force, their requirements are stupid high.
And the Marines compared to the Navy aren't? I feel as if like the Marines and the Army are kind of within that same like spectrum where it doesn't require that.
So so I'm telling you the stereotypical shit that I hear secondhand from my friends, right? So from my understanding is that the Marines aren't that smart. They're I don't understand where this started from, but they're a bunch of crayon eating guys. So they're tough as balls, but they're not so smart. That's the gist that I get from what they tell me. And the Navy, they're smart, but a bunch of pussies.
Dang. But okay. They are smart.
So that's what I heard, right? I'm not in the military. I just hear the bickering back and forth between the people who are in the military. I'm like, okay, damn, I thought we were all on the same team. They're like, nah, fuck those guys. I'm like, okay, that's cool. So the Air Force, you have to be smart, right, to get in. Yeah,
most definitely.
And you have to be extremely physically fit, right? That's why they're kind of above the Marines, because you could be physically fit and dumb as a brick and you cannot get into the Air Force, right? So you could probably be a Marine.
Yeah.
Right. So then you subtract the physical aspect of the Marine and then you could be in the Navy, right? I know, it's so sad. I don't know if none of this is true.
I have no idea. My brother doesn't even care about the Navy. He's like, oh, fuck this shit. Like, no, seriously. Like, you go for 4 years and then they pay for your schooling. Like, well.
What I am going to say from personal experience, right? Because this is just stereotypes. This could be like, oh, total horseshit, right? This could be all bullshit. I am going to be completely honest. I've had more issues with Marines than I've had with any other branch, like personally. Like dudes who I've had problems with who are in the military have been Marines.
That makes sense. I mean,
like, I'm not going to name names, but one of my coworkers, we almost got into a shootout at work because he wanted to start some shit and he had anger issues. He was Marine.
okay, that makes sense. Well,
right.
Army makes
One of my
sense
other
too.
coworkers who I was cool with wanted to fight me because he was drunk. He wanted to fight somebody. He was like, who else could I fight? My friend.
He's one of those dudes. Okay.
Yeah. He was also a Marine. Cool guy. Love him. He's awesome. And then a couple other friends, just a regular guy, kind of works out. Kind of dumb. In the Army. Like, yeah, I know.
What are you saying? What are you saying?
We can say, yeah. It was a little like that. And I was like, okay. And the funny part is that I didn't know any of this until someone pointed it out. I'm like, oh, that does make sense. He does have anger issues. He might eat crayons. Okay. Gotcha.
I need to check in with my friend who's a lieutenant in the Air Force.
Oh, he's a lieutenant? Oh, he's
yeah.
probably really smart.
He's super smart.
See?
Like he's hella smart. And I'm
It's
like,
weird.
How old are you, dude? He's like, oh yeah, I'm 27. I'm like,
damn it.
Fuck. I'm like, okay, that's cool, I guess.
Like, how are you smarter than me and you're younger than me, motherfucker?
He's where is he right now? I think he's in Germany.
So from my understanding is that you take a test, right?
Mm-hmm.
I think it's like the ASVAB.
Yeah, the
ASVAB.
Mm-hmm.
I can't
ASVAB.
pronounce. Yeah. Depending on how high you score, depends on what branch of the military you can get into, right? So if
What branch and what job you're gonna get? Yeah.
so if you're dumb,
You're gonna get like infantry, right? Pretty sure.
possibly,
I mean,
right? But if you're dumb, right? If you score really low,
they're gonna send you out to the field. Like,
yeah.
local deals.
But here's the
That's shitty.
So let's. I'm just gonna Google it. As VAC.
Yeah, ASVAB right there.
Oh. What would it be? Scores.
Yeah, right there. Score range.
Okay, let's go. The Air Force. You need to score
At least 36 to 99.
36 to 99 to be in the Air Force, right?
A handful of high school graduates who can score as low as 31.
It's 31. Let's go to the Army. So you keep those numbers in your head. Oh, look, even better.
Oh, cool. That has a range.
So the lowest is the Army. 31 ASVAC. Okay.
So
And then
see, look, it should be Air Force, Navy, then Marines, and the Army. Wait, where's Coast Guard?
they didn't make the list. Sorry. They didn't make the list. But see, that's more or less on it, right?
I'm gonna check in with my friend about that. Like, do you have to take that to be
Ask him.
Coast Guard?
Ask him what his score is.
I'm gonna ask. Yeah.
Be like, hey, how come you didn't get into the Navy? Was your ASVAB a little low? Was it a 36?
But he lived in Hawaii for a while.
Oh, yeah.
Yeah, he lived in Hawaii, and I think he's now like up north or some shit. I don't fucking know.
Hey, man, hats off to any of the guys that like in our armed forces, man.
Oh yeah, definitely.
No matter how many crayons they eat. Love those guys. I heard the purple crayon tastes the best.
Does it taste like that purple stuff?
No, it tastes nothing like purple. It tastes like blueberry. No, I'm just fucking with you. But yeah, man, like, so the scores all kind of reflect more. Like 31 Army, like Navy, 35, Marines, 32, Air Force, 36. So, like I said, Air Force, they kind of need to be physically fit and really, really smart. Marines just need to kind of be physically fit The Navy just needs to be smart. I could be completely wrong. Someone's going to correct me. I know it. There's going to be like a war in the comments of like Marines and Army people, and some Coast Guards be like, what the fuck?
Perhaps. I don't know. I have a friend who's in the Navy and he's a corpsman. So.
Hey, man, I'll let them hash it out in the comments. Right? Like, they'd be like, no, we're the best. No, we're the best. No, we eat the most crayons. Like, whatever.
You'll make your crayon soup, okay?
I love my friends. They're fucking, dude. I wish I would have been in the military just so I can enjoy these jokes, because I needed them to explain it to me before I understand it, and then I kind of feel dumb. But then after I start hearing it I'm like, oh, that was funny. Yeah.
Nah, it's understandable.
Yeah. Like one of our old coworkers. So I might be butchering this, but my friend who wanted to fight me was a machine gunner. Right. I'm assuming he worked on machine guns. Right. And then there was a female who was also a Marine. Right. But apparently there's prejudice inside of the Marines that all Marines are not created equal. Right. She was a female, for one. So she was already getting looked down on a little bit. I could kind of tell. Just because she was female. She was an African-American female. I didn't think it was race-based. I think it was just because she was a female. He found out through just conversating that she was also a Marine. He started busting her balls, ovaries, you could say. And he asked her job, right? And she said inventory or something along those lines, like warehouse. Mm-hmm. And he was like, oh. I was like, what the fuck? And I'm listening to this conversation, right? Because he's a machine gunner. He's seen action or whatever. And I was like, but both of you guys are Marines. The fuck does it matter if her job was warehouse? So a day goes by and I ask her. And he's like, oh, it's because they assume that because I'm warehouse, I don't do anything. I was like, what do you mean? Like, you're a Marine. Didn't you go through like the whole Hell Week and all that? Yeah, I did. I was like, so what the fuck does it matter if you're a fucking warehouse person? Oh, it's because this is a machine gunner. He feels badass. I was like, explain. Well, his job is to be working on a machine gun, handling the machine gun. My job is to provide him with fucking bullets. I was like, oh, I get it. Your inventory. You hand out the stuff that they fuck with. He fucks with it. So that's why he's like, oh, he's busting your balls. I get it. But it's so strange. I'm like, aren't you guys on the same fucking team? Right? It's weird. But I love them. They're funny. Besides this tangent, I wanted to bring up your modeling.
Stop.
Oh, you. Me. With your Instagram, what is it? I'll let you say it because I suck at.
It's nurse.chrischaos.
Yes. So I alluded to this earlier at the beginning of the podcast that you're a model, right? You're a nurse who saves lives, and you're also a part-time model.
Sure.
Oh, sure. My gosh.
I haven't done anything. I really don't.
Oh, okay. So I'm just gonna scroll through a little bit of your Instagram because I'm pretty sure some of these people are going to find you and be like, she's kind of cute. Right. So you're into pinup. And then, you did this with Chris.
Yes, Chris Gomez. Love that guy.
He does good work. Good work. So what the fuck got you into pinup modeling? Because that is a niche within a niche.
I don't know. I like the aesthetics. Obviously, I like the music. And
because
honestly,
you weren't always a pinup. You weren't always into rockabilly.
No.
Because if I scroll further down.
Where is he?
I don't know if it'll go down this far. Oh, look, there's the dad. Oh, wow. You've been a pinup for a while. Where are those? Oh no, is that it?
Remember, because I had my other one, like, I don't know, probably like a red flag fucking said something, and I had an original account, and then
I remember there was a nice cute picture of you like young and no tattoos. not all done up, looking like a regular person.
A regular person. Keep scrolling.
Wait, no, here's a good one. Kind of, almost. Platinum blonde, huh? Some streaks.
Yeah.
Like left side was
It was a trial. It
was like,
a change. And
can I not wear it? You know what's really funny? It's sort of like your bottom became your top and your top became your bottom.
I see.
Yeah. A little bit.
I don't know where that top is. I really miss it though.
So you weren't always a pinup. When did this happen? Like what sparked this? Like what sparked the old soul in you?
Lack of representation from the African American community. Like we're not, I love everybody, so it sucks that it's a competition at times for pinups.
Oh yeah.
And just the whole like representation and, even how you and I are talking, I told you that like there's not a lot of like African American people that I've seen in the community.
I've noticed that, yeah.
When I go to shows, where did I go to? Silverado Showdown. And
right.
I think I saw like maybe another Black person there too.
Isn't it kind of scary? Because I'll be honest.
Yes and no. Because honestly, people, they really don't know what my ethnicity is. So sometimes they are like, oh, she's probably Hispanic or something. And I'm like, no, I just hang out with a lot of them. They're pretty cool. And I like their food.
You're brown by association?
Pretty much.
Okay.
Pretty much.
Because I'll be honest with you, if I go anywhere, right, and I'm the only Mexican, I get kind of nervous. Like if they're all white people, I get kind of nervous.
Oh, I mean, I don't go around like all white people.
Well, no, like,
but like the whole rockabilly scene and stuff like, especially when I was at Silverado Showdown, I was like, ooh, we're in an area, we're in a certain type of area.
Can kind of like, be like, where are all the colored people at? Because I'm not gonna lie, I'd rather be in a group of all Black people and I'm the only Mexican instead of being in a group of all white people and I'm the only Mexican. Because I don't know, I really haven't figured that one out yet, but it's just weird. Like if I'm the only Mexican boy in a group of white people, I'm like, oh, there's a good chance one of these motherfuckers don't like me.
I honestly don't think I've ever been with another like African American person with me at a show or anything like that. It's always been like
next time you do, next time you see,
I'll let you know.
Yeah, I'll be like, hey, never get nervous.
You know what? I probably should ask someone. There's because I recently started following him. I forgot his Instagram name, but you know what? I should ask him because he's into the scene as well.
Because it's a small community. It like after a while, everybody gets to know everybody, right?
Unfortunately, yes.
Unfortunately, hey, that's a problem to some, and another not so much.
Oh. True.
To some, it's an issue. To some, it's not. But it's a small community, which means it's a good thing. That means you get to like mingle with people, and then like you just so happen to see the same people at shows.
Yeah.
Like probably like in another complete different city, right?
Yeah.
Because the scene kind of follows a set group of bands and like events. Like the big one, what is it? Like it used to be Bohuff. Then Viva, and then the one in Berlin.
Which one?
There's like a big rockabilly thing in Germany, I think. Like huge. There's like they like shut. I'll look it up.
I was like, I know about Psychobilly. Cyclone is in Spain, I believe.
Germany. I could be fucking it up. Is it Spain?
I think it is Spain. It's Psychobilly though.
I remember there was this huge rockabilly event in Europe. I just can't remember where. You might be right. You might be right. But it's like a humongous thing. Like they shut down an entire city or freeway. Because I've seen videos of them like doing crazy stunts on the freeway. Not that we don't do that, but it's like one specific scene.
Yeah.
You know? But when you got into the community, you were just like, okay, this is it.
It's like it's not like I know like well-known models. I honestly don't.
Mm-hmm.
Like I'll follow them and everything like that. It's not like I talk to them or anything. Just like follow for follow.
But why did you want to start modeling, specifically pinup? When you could have like modeled like Vogue or fucking any fashion line or fucking, do your traditional modeling.
Because I felt like Vogue isn't me.
Okay, that's true. Right. But you know what I mean? Like, I don't know, Dolls Kill or fucking, there's like different avenues, different styles. Why specifically rockabilly?
I don't know, just growing up with it. Like my parents are baby boomers. So just listening to the music and,
that makes more sense.
Being around like the aesthetics, like I said, and, watching movies and just, shit like that.
Blood in and blood out,
But
don't lie, you love that movie.
It's a long ass movie.
It's a long ass. No, The Godfather's a long ass movie.
You know what? I have yet to like sit through the whole thing.
You haven't finished?
Nah,
I don't know how we're friends.
I'm.
But your look is amazing. Look at you being all cute.
Oh, stop.
So when was the first time you got published?
Last year I got published.
Last year?
Yeah, pre-COVID, yeah. By Alyssa Martell. She was the photographer.
Is it up on this page?
She should be. It's on the tag. So go back. Go down.
Down.
Yeah. So the one in pink. Go.
This one.
Yeah. So I'm published at what's it called? Pinup Culture.
I think it's right there. No. I don't see it, but there's a lot of tags, and I don't read. So walk me through this experience because one, you're a pinup, which is already a small community. Two, you're African American, which is an even smaller community apparently in the pinup culture. And three, you actually managed to get published.
Yeah. So, what is it? I reached out to someone who's like associated with like, just who like wants to promote, women of color, like specifically African American women.
Mm-hmm.
I've submitted photos to her and everything like that. And she was like, no.
Oh shit. I thought you were like, yes.
And I was like, fuck it, whatever. So, I told Alyssa and she was like, oh yeah, I'll submit it to like, these different, magazines, and she submitted to Pinup Culture. And, once I found out I was published there, I was like, fuck yeah, like Pinup Culture? Like, hell yeah.
One of the magazines to get published in?
Yeah,
of course.
No, definitely. And I was like, all right, cool. I got fucking published there. I was like, all right, other magazine that I'm not going to mention that didn't want me. I was like, all right, cool. But, this year, the person reached out and I was like, oh yeah, by the way, you're Miss November. And I was like, what?
Wait, what?
Yeah, they told me that I'm Miss November in their calendar. And I'm like, okay, sure. Like I didn't I don't know how that shit works. Honestly, I really don't know.
Oh, really?
I really don't know how anything works like that, to be completely honest. Like,
so was that the other magazine that turned you down?
Yeah. That was
and then you're Miss November for that magazine?
Yeah.
How the fuck?
Exactly. Right?
That sounds suspect.
Yeah. No. I was like, this doesn't make sense. And what was it? They're like, oh, did you get your calendar? I'm like, why the fuck am I going to buy my own calendar?
Yeah, you're supposed to just get it.
Right? You would think so, but no.
I would. Yeah, I would assume so. Yeah, like I'm in the motherfucker. I better get a copy.
Right? I guess I have to pay $15 for it.
Fuck no.
And I'm like, it's okay. It's cool. I don't want.
Oh, did you get paid
for it? No.
That sounds suspicious.
No, I haven't gotten paid for anything, which is, I think I'd like to one day to get at that, that level to get paid.
Would you be open to modeling other styles, like other genres?
Yeah, no, yeah. Most definitely.
So if someone wanted to reach out to you and be like, I don't know, model someone's clothing line that they're dropping, what would you charge them?
I don't
Exactly.
Exactly. I
Get on
wouldn't
that.
know.
Get on that.
But now it's like, what is it? It's time for productivity or whatever. They like give you products, like their clothes and stuff like that.
For collaboration with them?
Yeah. And now I'm like, I should like, I need to reach out to some girls and see like, hey, how much do you guys charge? Because like, dude, the time that like I'm putting into myself for, you know, a 2-hour photo shoot or whatever, and then I'm just getting clothing.
Kind of,
Like
better be some good ass clothing.
Like even clothing that like I'm pretty sure I would never wear. Yeah. So
at what point would you go, okay, I'll give up nursing for modeling?
probably never.
Not even for a super fat paycheck?
Yeah, no.
Not even for a contract?
Probably not. I don't know. I don't think so.
So if like Gucci was like, you, summer line.
You'll see me in the summer. That's it.
So you'll do this shoot and then go back to like the ER.
Like I'll go back to wherever, but
But okay, my question is like, if you do hit it big, right? Like if you put in the effort, you get some notoriety and God graces you with some opportunity, but it's going to take up all of your time. Would you take that opportunity or stay in nursing?
I think I'd take the opportunity, you know, because I've always wanted to be a model, and, you know, I just didn't have that support that, you know, would like, oh yeah, you should go ahead and do it. And, you know, I support you 100%. I didn't have that support.
So the reason I say that is because I wanted to segue, because me and you had a project last year that fell through, right?
Yeah.
I'm going to talk about that now. And I've been avoiding talking about that because other people have been asking me about that for the longest.
I bet. I know.
So you have a striking resemblance to a celebrity who's no longer with us anymore. Let's go to my page, right? Let's go to my profile, right? So I wanted to do something fun for people who want to cosplay, right?
Yeah.
Just spotlight people who make cosplays. And for people who don't know, which you guys should know, is people who make costumes. And I wanted to spotlight those people because usually the people that get the attention are the people who wear them, people who pull it off. And I wanted to hire a team to show their work, right? I was going to pay them. I was going to pay them $1,000 to make the cosplay. Some people say that's cheap. Some people say that's expensive. It all depends on them. I proposed this idea of you cosplaying a specific character from a movie, Queen of the Damned, because you bear a striking resemblance to Aaliyah, who passed away. And even these pictures, damn it, that's stupid close, right? There's some facial features, right? But you guys have the same body type. And you guys are both gorgeous. So the premise of the idea, right, was you to cosplay her. I hired a quote unquote professional to make the cosplay. The idea was they were going to make the cosplay. They were going to shoot themselves doing their own work. And then I was going to put their cosplay on display on you and then make a video about it and then give them the credit, pay them for their work. And then everybody walks out winning. They get more clients. I get viewers. And then I can steamroll this into the next project. This is before the wheels fell off the train. So you came with me to this meeting, right?
Yeah.
What'd you think about them when you met them? Be honest.
I thought, well, who was it? The one who did the costuming. I thought she was a little bit not
high strung
and like very eccentric.
That's a good word. Yes.
Yeah, I'm just gonna use that.
Eccentric. She was a bit eccentric.
And even when she came to my place, she was like, "Oh no, I don't want to go in." But I was like, "I'm not asking you to come in, bitch. Please do not come into my house."
Right, because we were doing this under COVID, right?
Yeah.
So everybody wore masks and everybody tried to be as safe as they could. And on my end, I tried to handle it as professionally as I could. So the premise was they had 1 month to knock it out. And when we had the meeting, they basically said they could, right? From A to Z, we got this. Cool. Are you sure? Yeah. They signed the contract. I paid them half up front for materials or whatever. They said that the price was fine. I was like, cool. Are you sure? If there's anything going on, let me know. So the whole deal was they were going to message me once a week on an update on where the cosplay was going. And if anything was going on or something needs to get altered, whatever, that's when we were going to talk about it. So the wheels fell off the train about 2 weeks in.
Yeah.
Oh my gosh. So we got as far as the cups
Yeah.
for your chest. And then that following week, we didn't get a single update. Well, I didn't get an update because they were messaging me. The first week was great. They managed to finish the dress, start the cups, which you can see here in the picture. They started what looks like to be the crown. And there was another person on our team. There was a jeweler, or supposedly a jeweler, because I never got to see any of it, who did the diagram. She was supposed to be in charge of all of the jewelry, the necklace, the bracelets, the crown, which were supposedly the hardest parts. On the second week, I asked her, hey, what's the update? And the costumer, what would be a good word for that?
Costume designer?
Yeah, the costume designer basically hit me back up in group chat saying that I'm stressing them out by hitting them up once a week as we agreed upon. I just asked for some updates. So the wheels fell off the train when they're like, we don't want to do this anymore. I was like, why? They're like, we don't like the way you're talking to us. I was like, really? I was like, what did I say that bothered you? We just don't like that you're messaging us for the updates and then you're not taking into consideration our time. I was like, what part was it that you felt that I was not taking your time into consideration? Just all of it. Just all of it. I was like, okay. Oh, well, I apologize. I didn't mean to make you feel that way. Is there anything we can do to rectify this and like continue with the project? Do you guys need more time? No, we just don't want to do it anymore. I was like, okay, well, you're contractually obligated that if you don't finish it, you're going to give me my money back. So are we good? And she's like, yeah, we're fine. I was like, also in the contract, it stipulates that if you don't finish it, anything you do or anything that you've done is my property. Like, yeah, we know that. I'm like, so you're going to just take a loss because I might have said something that got taken the wrong way over text message. So are you sure there's nothing we can do? No. I was like, okay, cool. So I think I told you the story. I met up with her and then she completely told me a different story. Did I tell you that part?
I don't remember. Pretty sure you did.
Okay.
Tell stories.
So we met up, right? She gave me the costume back. She gave me the $500 deposit. And I asked her, I'm like, look, I really don't want to find another team to do the cosplay because you guys already did great. The first week, you guys already got the dress done. You guys already got the cups done. Like, is there anything we could do to work this out? Like, I apologize if there's anything I said that might have been misconstrued. And she was like, no, it's not anything you said. I was like, what? She's like, yeah, it's nothing you said. I was like, okay, so what's the problem? Well, it's my jeweler. I was like, oh, okay. What happened with the jeweler? We work together and work's been a lot lately and she doesn't want to do it. And I've been doing all of it and I have to do all the work. I don't think I can finish it in a month's time. I was like, that's fine. I can give you more time. Just, I don't want to find another team. If that means we find another jeweler, then that's fine. She's like, no, I just don't want to deal with the problems. I was like, damn, cool. So we scrapped the whole project and I'm actually finishing the project now. So I had to learn how to do all this fun cosplay stuff because I've never done it. I've always been in the cosplay community, but I've never done it myself. So hopefully after this podcast is done, I can measure your wrists out because I finished one of the cuffs.
Ooh. Ooh.
You don't seem that excited, but it's okay.
No, I was actually thinking about that on the way here. I was like, shit, I'm here. Might as well. Just do
Well,
it.
yeah, I need your wrists, lady. I need to measure those things.
Dude, you're fucking far.
Yeah, I've told you this a million times, but you bear a striking resemblance to Aaliyah. The reason I bring this up, right, on this whole cosplay tangent in our project that we will finish, people, we will finish it at some point. Hopefully it's Halloween.
Yeah.
Hopefully it's Halloween. But that means I gotta do it. I don't know how to sew. I'm learning how to like fold stuff in foam. And if you guys give me a second, I'll show you. Hold on. So that is the bracelet, right?
Okay.
It's not painted yet and it's not formed to your wrist. So the way it's supposed to go is like you, let me see, stick your hand out. Yeah. So it's a quick test fit. Oh, that might work. So there's going to be some Velcro involved and some, but yeah, that's supposed to be the bracelets that she's wearing. I'll leave that somewhere over there. Right. But the reason I bring this up is because I think you should get into acting.
Why do you say that?
Because you have an amazing personality and you're hot. So duh. The fuck. If I was fucking good looking as fuck, I'd fucking be in acting, but I just have a funny personality. I don't feel like being a comedian.
I mean,
that's why I got a podcast, bitch.
I don't know about acting, but like modeling, sure, why not? Like, I think I'd enjoy that more than acting, to be completely honest. Yeah.
Acting seems like so much fun.
I don't know, like just how many takes that you'd have to do for like one like segment or whatever. And like someone fucks it up. Like, I don't know. I get irritated really.
You're such a bitch.
Like, come on, what the fuck? Like,
get your fucking line, bro. Fucking Brad Pitt. God. Jesus.
But no, I think I'm just shoot photos of me. That's it.
Well, everybody gets nervous in front of the camera. And I even like when I started this podcast, a lot of people who I'd assume would be like, great, let me get on. I asked them to come on. I'm like, nah, I can't do good in front of a camera. I'm like, bro, but you're such a fucking live wire by yourself. Yeah. Like, nah, I can't talk and be recorded at the same time. I don't know what to say. I'll freeze. I'm like, interesting.
I'm just going with the flow, honestly.
I think that's how everybody should be, but not everybody is. But I think you do well. I think you maybe commercials where you just show your hands and you do the nice little.
Oh God, no! I got skeletal hands and feet. No,
Skeletor.
I'm dead serious. My work wife and I were actually talking about this. We're like, we will never make money with our feet because I have skeletal feet and
I call bullshit.
Her toenails my feet are just.
I call bullshit. There's gonna be some man out there on the internet who would love to see your feet. You can start an OnlyFans.
Just my feet.
Just your feet. I guarantee it. I guarantee it.
I don't even like my feet. I'm like self-conscious. Like legit, I am really self-conscious of my feet and my hands, to be completely honest.
Oh, well, they look fine in these pictures.
Well, thank you.
Right. I think you could do great. But hey, that's just my opinion, you know? That's just me. But, well, I digress. So we've been on for about 2 hours. So if someone wanted to find you for modeling, where would they find you?
Instagram. Mainly Instagram. Don't Facebook me. I do not check messages on Facebook. I have about like 20.
Yeah, don't give out your Facebook.
Yeah, no.
Instagram's a little safer. Yeah.
Instagram me.
Yeah.
Just check me out on Instagram.
And paid modeling, right? For only paid modeling. Yes.
No, definitely.
Opportunities. You have a beautiful face. You have a beautiful career. You have a beautiful mind. Very talented. Very caring. Very much an asshole.
Well, that's what makes me me.
I know.
That's why you love me.
I do. I hate you so much sometimes.
I
So
know you
much.
do. It's okay.
So much. I was going to strangle you today.
I'm here. So
But I needed a podcast guest, and I couldn't kill you before I got you recorded. After is a different story.
whoa.
So where can they find you? Give me your handles. Throw them out there.
What is it? Just nurse.chrischaos. You could even just type in Krystal Jade. I pop up sometimes, I believe. Yeah, pretty much there.
Cool. I love having you on. Hey, you're fun. You're my friend. And
Thank you.
keep doing your nursing thing. Thank you for your service. And keep modeling. Like you're doing great. I think you could do more. I really do.
You could slide me a 20 for that. Thank you.
I'll be sending you the bill for the podcast later. But yeah, I think you could be doing great. But thank you for coming on. I really appreciate it. And good night, everybody. Stay crazy, stay insane, and stay safe. All right. You guys have a good night.